A retired military K-9 crashed through the emergency room doors of Hargrove Medical Center like something had broken loose from a nightmare. Doctors dove behind carts, nurses scattered. A security guard reached for his radio with hands that wouldn't stop shaking. The dog, a Belgian Malinois with a scar running from his left ear to his jaw, moved through the chaos like it didn't exist. He passed the trauma bays, ignored the shouting, walked the full length of the hallway until he reached a woman standing alone at the far end, clipboard in hand, watching him come. He stopped, lowered his massive head, and pressed it against her knee like he was reporting for duty. Nobody in that room understood what they were seeing, but the dog did. If this story already has you leaning forward, follow my channel and stay with me until the end. I promise you it's worth it. Hit like and drop a comment telling me what city you're watching from. I want to see exactly how far this story travels. The morning had started the way most mornings started at Hargrove Medical Center, badly, and getting worse by the hour. Nora Voss arrived at 5:47 a.m., 13 minutes before her shift technically began, because the overnight charge nurse always left the supply cabinet in the wrong order and someone had to fix it before the day nurses came in and couldn't find anything. That someone was always Nora, not because it was her job, because no one else bothered and patients needed the right medications pulled in the right sequence, and that mattered more than whose name was supposed to be on the task. She was 34 years old, 5'6", and built like someone who had spent a significant portion of her life doing things that required sustained physical endurance rather than gym aesthetics. Her dark hair was pulled back tight. No makeup, not out of indifference, but out of a calculation she'd made years ago that anything on her face would be gone within 90 minutes of a real shift anyway. She had been working at Hargrove for 2 years and 3 months. In that time, she had been passed over for the senior nursing position twice, written up once for what Sandra Pruitt's documentation called insubordination, and what Nora called correctly identifying a misdiagnosed stroke before the attending got around to noticing, and assigned to graveyard rotation so consistently that she'd stopped counting how many weeks in a row it had happened before she simply stopped tracking. The ER at Hargrove wasn't a terrible place. It was adequately funded, reasonably staffed, and located in Denton Falls, a mid-sized city in western Montana that generated enough trauma volume to keep the department genuinely busy without tipping into the managed chaos of an urban Level 1 center. The problem wasn't the hospital. The problem was something more specific and harder to name. A particular arrangement of people and institutional habit that had calcified over years, a hierarchy with a clear understanding of whose instincts counted and whose didn't. Nora had figured out within her first month which category she fell into. She finished with the supply cabinet, clocked in at 5:59, and took her first patient at 6:04. Construction worker, nail through the palm. She got him cleaned and imaging ordered before the attending officially came on. By the time Webb arrived and looked at the chart, the work was half done. That was how most of her mornings went. Dr. Marcus Webb was the kind of physician who had been trained well and knew it, and had somewhere along the way confused knowing it with being right about everything. He was in his late 40s, trim, methodical, and capable, genuinely capable, on the clinical side. He ran a tight trauma bay when things got serious. What he couldn't do, or wouldn't do, was hear a correction from someone who outranked him on his internal map of who was worth listening to. Nurses were not on that map. Nurses were tools with pulses. You told them what you needed and they produced it, and if they offered an opinion, you waited for them to finish and then moved on. Nora had learned this about him in her first week. She had adjusted her approach. She didn't offer opinions anymore. She offered data, presented in a way that made it difficult to dismiss without looking careless. It worked about 60% of the time, which she considered a functional result. Voss, Webb at the nursing station, not looking up from his tablet. Bed 4, abdominal pain, possible appendicitis, labs. Already running, Nora said. Sent them at 6:10. Also, the pain migration in his presentation is atypical. Classic appendicitis moves right lower quadrant and stays there. His is shifting. Could be Meckel's diverticulum. Webb looked at her. The look lasted about 2 seconds and communicated nothing except that he had heard her and was filing it under commentary he had not requested. I'll assess when I've reviewed the labs. Of course, Nora said, and went to check on the teenager in Bay 6, whose asthma had responded well to treatment and who was now well enough to be arguing with his mother about whether he could keep his vape pen. The Meckles labs came back at 7:40. Webb ordered the CT without saying anything to Nora, and the CT confirmed her read. He directed the surgical consult. He didn't acknowledge what had happened. Nora had learned to let these moments go. Not because she didn't notice, but because spending energy on them was a trade-off she couldn't afford. There was always another patient. Sandra Pruitt arrived at her usual time, 8 sharp, with the air of someone who considered punctuality a moral virtue rather than a professional expectation. She was the day shift charge nurse, and she had been at Hargrove for 19 years, which was long enough that the institutional rhythms of the place had essentially become her personality. She knew every policy, every protocol, every administrator by first name. She also knew, with the certainty of someone who had never had reason to question it, exactly how a hospital was supposed to function and exactly where the lines were. Nora existed outside those lines in ways that Sandra found personally offensive. The conversation came at 9:30. Sandra flagged her down in the main corridor, the one that ran between the intake area and the trauma bays, where there was always enough foot traffic to make a private conversation feel slightly absurd. "Last Thursday," Sandra said. "The Hendricks case. Dr. Webb filed a report." Nora kept moving, pulling a medication cart into position near Bay 2. "I identified a medication interaction. His INR was elevated and Webb had ordered an NSAID on top of his existing anticoagulant therapy. That combination causes—" "I know what it causes," Sandra said. "You pointed it out in front of the family." The patient was already showing symptoms. There wasn't time to find a private hallway. "There's always time." "Sandra." Nora paused and looked at her directly. The patient's nose was bleeding at the nursing station. His wife was panicking. If I had pulled Webb aside for a quiet professional conversation, we would have been having that conversation while the man's blood thinned further. I made a call. "You made a call that wasn't yours to make." "Somebody had to." Sandra's expression settled into something hard and practiced. She had done this before. This specific conversation, in this specific register. "I've put a formal performance review in motion. It begins Monday. I need you to think seriously about whether this department is the right fit for your—" "My what?" Nora asked. Sandra paused. "Your temperament." Nora looked at her for a moment. The words sat in the air between them, like something Sandra had chosen deliberately. Not her skills, not her qualifications, her temperament. "Understood," Nora said, and went back to work. The morning continued. A woman in her 60s with chest tightness that turned out to be atypical angina rather than the anxiety her primary care physician had been treating for 6 months. A teenager with a sports injury that was being dramatically underplayed by a father who kept saying, "He's tough, he's fine," while his son's ankle swelled visibly between sentences. An elderly man with altered mental status that the admitting note attributed to dehydration, which Nora flagged for a UTI workup, which came back positive, which nobody thanked her for doing. She moved through all of it with the focused efficiency that had characterized her work since she'd started here. Not perfect, never perfect, but present and attentive in a way that the department's pace tried constantly to erode and couldn't quite manage. There were moments of friction. A missed IV line on the first attempt with a difficult stick that required a second pass and cost her 2 minutes she didn't have. A miscommunication with the lab about sample labeling that sent her back to the nursing station to sort out. She was human. She made mistakes, but they were always the small mistakes of someone working quickly and carefully rather than the larger mistakes of someone not paying attention, and she knew the difference. At 11:17, the ambulance bay doors opened. Nora heard the commotion before she saw it, the sudden shift in the ambient noise of the intake area, voices going uncertain and then alarmed, the particular sound of people moving out of the way of something they didn't understand. She came around the corner from Bay 6 and stopped. The paramedic team was coming through with a gurney, standard presentation. Male patient, bandaged forearm, vitals monitor clipped to the rail. But moving alongside the gurney, matching its pace precisely, was the dog. He was a Belgian Malinois, and he was large even for the breed, with the muscle density of a working animal kept at peak condition. His coat was the warm tan and black saddle pattern standard to the breed, but the scar was not standard. It ran from just behind his left ear down the side of his jaw, healed clean but deep, the kind of mark left by something that had been meant to do serious damage. He moved through the intake area with his head slightly lowered and his eyes tracking everything at once, and he moved like he'd been in rooms like this before, like he understood them. The nursing staff had flattened against the walls. Someone near intake said something that wasn't quite a word. Sandra appeared from the direction of her office and stopped when she saw the animal. "What is that doing in here?" she said, in the tone of someone who considered the question rhetorical. "He's a retired K9, the lead paramedic said, a woman named Torres, whom Nora knew slightly. The handler wouldn't authorize transport without the dog. Dog wouldn't leave the gurney. We made a judgment call. This is a medical facility." Nora was already moving. She fell into step beside the gurney on the opposite side from the dog, pulling on gloves. "Torres, what's the injury?" "Radial laceration, deep, possible tendon involvement. Table saw accident. Time of injury approximately 50 minutes ago." Nora checked the bandaging with her eyes without lifting it. The saturation rate, the color, the way the pressure dressing was holding. She looked at the patient. He was in his mid-40s, she estimated. Close-cropped gray at the temples, jaw set. The eyes of someone who had decided pain was a management problem rather than an experience. He was looking at the dog periodically, checking him the way people check the people they're responsible for, and the dog was tracking him in return. "What's your name?" Nora asked. "Caleb Merritt." Controlled voice, a voice that was accustomed to functioning under stress. "I'm Nora. You're keeping pressure on that arm, and you're going to keep it there until I tell you otherwise." "What's the dog's name?" A slight shift in his expression. He hadn't expected her to include the dog. "Ruck." "Ruck." Nora looked at the animal. He looked back at her with amber eyes that were calm and assessing and very, very alert. "Ruck heel." The dog moved to her side of the gurney without hesitation. From behind them, Sandra said something. Nora didn't hear it because she had stopped paying attention to Sandra and was focused on Caleb's color, his breathing rate, the slight tremor in the hand he wasn't using to hold the dressing. They got him into trauma bay 2. Webb appeared, reviewed the situation, began his assessment. Nora started the IV, good access on the first try, left AC, and pulled the initial labs. She got a blood pressure reading she didn't love, 101/66, which was low enough to pay attention to. "History?" she asked Caleb, while Webb was examining the wound. "Nothing current. I'm pretty healthy." "Surgeries?" "Right shoulder 8 years ago, and a thing with my knee about 4 years back." "Medications?" "Nothing prescription. Ibuprofen when the shoulder acts up." She noted it all. "When did you eat last?" "This morning, early." "How early?" 5:30. She adjusted the IV fluid rate slightly and went to update the chart. Behind her, she heard Webb telling the orderly to take the dog to the waiting area, and she heard the orderly approach Ruck, and she heard the quality of silence that followed, which was the silence of a very large and very well-trained animal making clear through stillness alone that it had not agreed to go anywhere. "Caleb," Nora said without turning around, "is Ruck registered as both a retired service animal and an emotional support animal?" A pause. "He's got documentation for both. VA issued it when he retired out." "Then he stays." She didn't raise her voice. She also didn't look at Webb. ADA covers documented emotional support animals in healthcare settings when separation would cause demonstrable distress to the handler. The handler is currently bleeding and has below baseline blood pressure, which qualifies. She pulled up the lab order screen. "Orderly, you can step out." There was a pause long enough to be uncomfortable, and then the orderly stepped out. Webb said nothing. He was looking at the wound and probably, she knew him well enough to know this, deciding that the path of least resistance was to let it go rather than spend energy on a policy argument while he had a patient to treat. She ordered the labs, including a D-dimer, because Caleb had mentioned limited mobility post-retirement, and the ibuprofen use suggested chronic inflammation, and she had learned a long time ago that post-surgical patients with sedentary periods and unexplained low normal blood pressure deserved a coagulation check. It was one additional tube of blood. It cost nothing except the decision to order it. While the labs were processing and Webb was arranging imaging, Nora found herself at the bedside doing a check on Caleb's vitals when Ruck moved, not toward her, but close enough that she could see the details of his scarring clearly for the first time. Along his left shoulder, partially hidden by his coat, there were additional marks, old, healed, but significant. The pattern was consistent with shrapnel disbursement. He took shrapnel, she said. Caleb looked at her. Yeah. When? 7 years ago. Kandahar. He paused. You know what you're looking at. It wasn't a question. The scarring pattern is specific, Nora said. She was checking Ruck's shoulder gait now, the subtle way he was compensating on his left side, shifting weight to the right when he stood still. He's been favoring this shoulder for a while. The muscle atrophy on the left side is noticeable if you know to look for it. Caleb was quiet for a moment. The VA's backlogged. I've been waiting 4 months for a specialist referral. For him specifically? For both of us, to be fair. Something almost like dark humor in his voice. But yeah, for him. The civilian vets I've tried don't have experience with the injury profile from that kind of work. I know someone who might, Nora said, and made a note in the margin of her pad, not the official chart. A name. A contact. Someone she hadn't called in a while. She looked up and found Caleb watching her with an expression she recognized as reassessment. The specific expression of someone who had walked in expecting one thing and was recalibrating. You've worked around these dogs before, he said. Not just seen them, worked with them. I know how to read working animals, Nora said, and I know what it looks like when one is protecting someone. Ruck isn't guarding you because he's anxious. He's guarding you because he made a decision. Yeah, Caleb said, and his voice was quieter. He does that. Webb came back with the imaging orders, and the room shifted to clinical business, and Nora stepped out to check the lab status, while the imaging team came in to prep Caleb. She stood at the nursing station with her notes and her lab screen, and the particular quality of attention she gave every case that she wasn't sure was complete yet. Sandra materialized at her elbow with the performance review document. Physical paper, printed, which was its own statement. She set it on the counter without preamble. I need your signature by end of shift, Sandra said. Read through it, ask questions if you have them, but I want it back before you clock out. Nora looked at the document, her name at the top. Below it, a carefully assembled narrative. Pattern of behavior inconsistent with departmental standards, repeated failure to maintain appropriate professional hierarchy, demonstrated inability to work collaboratively with attending physicians. The Hendricks incident. The conversation this morning, already documented with a speed that suggested Sandra had been composing it during Nora's busiest hours. A prior write-up from 4 months ago about the pulmonary embolism she'd flagged that had been initially dismissed as a panic attack. What was not in the document, the outcomes. The stroke caught before it became a catastrophic bleed. The PE treated before it became fatal. The medication interaction corrected before the INR climbed into a dangerous range. These were not listed because they had not been filed anywhere that mattered, which was itself a kind of answer. I'll read it, Nora said. End of shift, Sandra said, and walked away. Nora looked at the document for another moment. Then she set it aside and went back to the nursing station to check her lab screen, because Caleb's results were due and she wanted to be the first one to see them. The labs came back at 1:48 p.m. Most of the panel was unremarkable. The D-dimer was elevated. Not dramatically. Not so elevated that it screamed on its own, but elevated in a patient with a recent surgical prep for tendon repair, limited mobility history, previous joint surgeries, and a current presentation of below baseline blood pressure. Elevated in a way that, stacked against those factors, told a specific story. Nora flagged it, updated the chart, and went to find Webb. He was between patients, reviewing his afternoon schedule. She handed him the relevant page of the results and said, without preamble, his D-dimer is elevated. Combined with his history and his BP, I think we should run a CT pulmonary angiography before we proceed to the repair. Webb looked at the numbers. It's mildly elevated. He's a trauma patient. Mild elevation isn't unusual. His blood pressure has been running low since he came in and hasn't normalized with fluids. That's not typical for an isolated arm laceration with the blood loss he's shown. Voss, I know you disagree with me, she said. I'm not asking you to certify that I'm right. I'm asking for one imaging study before we put him under for a procedure that would make treatment of an undetected PE significantly more complicated. She paused. If I'm wrong, we've spent 40 minutes and you can document it. Webb looked at her. The particular quality of his look was something she had learned to read over 2 years. the brief internal calculation of a physician deciding whether an argument was worth having against the nurse who had, he was now aware, correctly identified two things today that he had initially dismissed. "Order it," he said. "If it's clean, we proceed." "Thank you," she said, and ordered it. She went back to Caleb's bay to let him know about the additional imaging and found the room in a different state than she'd left it. Ruck was standing. He had been down for hours, the controlled stillness of a working animal at rest. But now he was on his feet, and the sound he was making was not quite a whine and not quite a growl, but something with urgency inside it, precise and directed, his nose working at Caleb's right hand where it rested on the blanket. Caleb wasn't responding. His eyes were closed and his monitors showed vitals that were technically within range, if you looked at each number individually, but Nora looked at the whole picture and saw what the numbers alone didn't say. The oxygen saturation reading that had drifted to 93, the heart rate running slightly fast in the compensatory pattern of a cardiovascular system working harder than it should be, the quality of stillness in his face that was not sleep. She was at the bedside in 4 steps. "Caleb," her hand on his shoulder, firm. "Open your eyes." Nothing. She checked his pulse manually. Present, but thin and fast. She lifted his eyelids and checked pupils. Sluggish response, which was not what post-procedural sedation looked like, because he hadn't had post-procedural sedation. He was waiting for imaging. She grabbed the portable oxygen sat probe and got a reading that confirmed what the monitor had been hinting at. She hit the call button. "I need Webb in Bay 2. Now. He's with a patient. Tell him PE protocol. Right now." She was already moving to the crash cart. She pulled it to position and started oxygen delivery, non-rebreather mask, getting his sat back up while she ran through the possibilities in sequence. The D-dimer. The history. The blood pressure that had never fully corrected. The imaging that had been ordered but not yet run. It had been there the whole time. Waiting. Webb came through this curtain at a controlled jog, which was as close to running as he allowed himself in the department. He looked at Caleb, looked at the monitor, looked at Nora. She handed him the timeline without being asked. Oxygen sat dropped to 92 over the past 20 minutes on the monitoring log. Heart rate elevated, compensatory. Altered mental status onset approximately 9 minutes ago, based on the last time I had confirmed verbal contact. She paused. The imaging was ordered, it wasn't run yet. Webb was already on the bedside, assessing, his hands moving in the fast, precise way of a physician who knew exactly what he was doing, even if he'd nearly missed the window to do it. "Get the imaging team back here," he said, "and get me a vascular consult." "Already paging," Nora said, because she was. What followed was 20 minutes of controlled and imperfect chaos, the kind where things went right, not because everyone performed flawlessly, but because the right information was available at the right moment, and the people in the room made fast enough decisions. Anticoagulants. Confirmatory imaging run bedside with portable equipment while Webb managed Caleb's hemodynamics. A second IV line when his pressure dropped, and they needed faster fluid access. Nora running between the crash cart and the bedside and the monitor, not stopping, not pausing, operating on the particular fuel source of someone who is trained for exactly this kind of situation in conditions where the consequences of stopping were worse than they were here. Ruck stood at the foot of the bed for the entire 20 minutes, completely still, watching. Caleb's pressure stabilized at 17 minutes. At 22 minutes, he opened his eyes. The imaging confirmed a small pulmonary embolism, right lower lobe, caught early. Treatment would be anticoagulation and monitoring. Prognosis was good because of timing. The attending vascular consultant, a woman named Dr. Faye Atchison, who had come down from the 5th floor at a pace that suggested she took Nora's page seriously, reviewed the situation and said to Webb, "Good catch." And Webb said, "The nurse flagged it early," which was the most credit he had ever given Nora for anything and probably cost him something to say. Dr. Atchison looked at Nora. "Which nurse?" "Voss," Webb said. Atchison looked at Nora with a kind of direct professional attention that Nora wasn't accustomed to receiving in this department. "The D-dimer was your call?" "Along with the initial flag. And I'd ordered the CT before he decompensated. It just hadn't run yet." Atchison nodded, once, in the way of someone who understood the specific frustration embedded in that sentence. Good instincts, she said, and went back to Caleb's chart. Nora cleaned up the crash cart. She wasn't particularly affected by the compliment. It was accurate, which was what mattered. And what mattered more was that Caleb Merritt was conscious and his oxygen levels were climbing back toward normal. She had a postcode checklist to complete and documentation that needed to be accurate and a performance review on the nursing station counter that she had not yet signed. She was finishing the documentation when she became aware of someone standing at the intake desk. She noticed him peripherally first, a man in civilian clothes, dark jacket, jeans, who moved with a contained efficiency that read wrong for a civilian visitor. The way he stood at the intake desk was too still, too measured, like someone accustomed to environments where unnecessary movement costs you something. He showed his ID to the intake nurse, a brief flash, and said something Nora couldn't hear from where she was standing. The intake nurse looked at the ID, then up at the man, then at her screen. Then she looked down the hallway toward the nursing station, and Nora had the distinct sensation of being located. "Purpose of your visit?" the intake nurse asked, loudly enough that Nora could catch it. "I'm here to check on a patient," the man said. His voice was neutral, flat, carrying without projection. "Sergeant Caleb Merritt, and I need to speak with the nurse who treated him." The intake nurse typed something. That would be Nora Voss. The man looked down the hallway. He found Nora without any apparent difficulty. Didn't scan, didn't search. Just looked directly to where she was standing as if he'd already known. He nodded, once. Sat down in the waiting area without being asked to. In Bay 2, Ruck had raised his head from Caleb's bedside. He was looking toward the entrance. His tail moved once, slow and deliberate, and then he was still again. Nora stood at the nursing station with the performance review in front of her, and a case she hadn't finished understanding, and a stranger in the waiting room who had known exactly where to look for her, and she had the specific feeling she'd learned over years to pay attention to. The feeling that what she thought this situation was, and what it actually was, were not the same thing. She picked up her pen. She did not sign the review. She put the pen down and went to check on Caleb. The man in the waiting room didn't introduce himself that night. Nora didn't go to him. She had a patient to monitor, documentation to finish, and a department that had just run a PE protocol and needed to be reset for whatever came through the doors next. If he wanted to speak with her, he could wait. He seemed like someone who understood how to wait. She checked on Caleb at 7:15. He was awake, pale, but oriented, with the oxygen saturation climbing steadily back toward normal. The anticoagulant drip was running. Dr. Atchison had left orders and a follow-up note that was more thorough than anything Nora had seen from a consultant in months. Ruck was back in his down position beside the bed, though his eyes tracked Nora when she came in with an attentiveness that hadn't relaxed since the code. "How are you feeling?" she asked Caleb. "Like something tried to kill me and didn't quite finish," he said. His voice was still controlled, but thinner now. The energy reserve he'd been running on since the ambulance bay had burned down to something smaller. "That's accurate," Nora said. She checked his IV site, his monitor readings, the color returning slowly to his face. The clot was small, caught early. "You're going to be here overnight at minimum, probably 2 nights. But the prognosis is good. Because you ordered the right test." "Because I ordered a test," she said. Webb ran the protocol. Caleb looked at her with the particular expression of someone who had spent enough time in institutional environments to understand the difference between what was said and what was true. He didn't press it. "There's a man in the waiting room," he said instead. "Civilian clothes, sits like he's never been a civilian. I noticed him. His name is Garrett Wills. We served together for a while. Different units eventually, but we go back." He paused. "He knew where I was before I could have told him, which means he's been keeping tabs." "On you?" "On the situation." Caleb's jaw tightened slightly. "Don't let him make you nervous. He's not a threat. He's just the kind of person who shows up when things get complicated." Nora filed that away. "Get some sleep," she said. "The night team will monitor your drip. I'll leave a detailed handoff note." She wrote the handoff note at the nursing station, longer and more specific than the format required, because the night nurse assigned to Caleb's bay was competent but not experienced with the particular coagulation dynamics of post-trauma patients with hidden risk factors, and Nora wanted the information available even if it wasn't asked for. She clocked out at 7:53. Garrett Wills stood up when she came through the waiting room. "Ms. Voss," he said. "It's Nora," she said, because she'd been called Ms. Voss today in exactly the tone Sandra used it, and she didn't want to hear it again. "You wanted to speak with me." "I did." He glanced around the waiting room, which had 3 other people in it: a tired woman with a sleeping child, an older man reading something on his phone. "Not here, ideally. I have about 8 minutes before I need to catch my bus," she said. "So here or nowhere." He considered that for approximately 1 second. "Caleb Merritt. You treated him today." "He's my patient. I can't discuss. I'm not asking about his treatment." Wills had the kind of voice that didn't change register much. Not cold, not warm, just calibrated. "I'm asking about the dog." Nora stopped. "Ruck," Wills said. "How did you handle him?" "Standard working animal protocol," she said carefully. "There is no standard working animal protocol at Hargrove Medical Center. I checked before I came." He looked at her steadily. "You gave him a command he responded to, a specific command, in a specific tone, that you don't learn from a handbook. You assessed his shoulder injury with the knowledge base of someone who has examined working dogs before. And Caleb told me, Ruck doesn't accept direction from strangers. Not anymore. Not since Kandahar." Nora was quiet. "I'm not here to cause problems for you," Wills said. "I'm here because Caleb almost died today, and because Ruck's injury has been on a list I've been monitoring for 6 months, and because whoever you are, you know things that people in your position don't typically know." He paused. "So I'm asking, professionally and off the record, who are you?" The tired woman across the waiting room shifted in her seat. The older man turned a page. "I'm a nurse," Nora said. "I'm good at my job. That's all you need right now." She picked up her bag. "Caleb is stable. Ruck is in the bay with him, which is where he should be. If you want to visit, the night desk will give you the room number." She left before he could respond. The bus ride home took 22 minutes. She sat in the back and looked out the window at Denton Falls going dark around her. The downtown blocks with their bars and restaurants starting to fill, the quieter residential streets beyond, the particular flatness of the Montana sky at dusk that she had never entirely gotten used to even after 2 years. She thought about Caleb's D-dimer. She thought about the way Ruck had stood up 3 minutes before Caleb's vitals showed anything measurable. She thought about Wills and the precise way he'd said, "I've been monitoring," past continuous, active, and ongoing, which was the tense of someone who hadn't stopped. She thought about Ruck's shoulder, the atrophy on the left side, the compensation pattern. She got home, made food she didn't fully taste, and was asleep by 10. Sandra's performance review was still on the nursing station counter, unsigned. Chab. She came back the next morning and Garrett Wills was already there. Not in the waiting room this time, at the nursing station, standing with Sandra Pruitt in a conversation that had the body language of 2 people who had just established that they did not like each other, but were maintaining professional surfaces about it. Sandra was holding a clipboard. Wills was holding nothing but stood like he didn't need to. Nora clocked in and walked toward them at her usual pace, which was the pace of someone who had somewhere to be and intended to get there. "Nora," Sandra said, in the voice she used when she wanted to convey that something was Nora's fault without specifying what. "This gentleman is asking about your patient from yesterday." "I'm aware," Nora said. "Mr. Wills, visiting hours start at 8. You can check on Caleb then." She pulled up the overnight notes on her station and started reading. "Caleb is fine," Wills said. "I saw him at 6. I'm here because of something else." He glanced at Sandra, a brief and courteous dismissal. "Could we speak privately?" "Whatever you have to say to my staff can be said here," Sandra said. Wills looked at Sandra with an expression that didn't change but somehow communicated that he had assessed her and reached a conclusion, and was now deciding how much to share of it. "All right, young," he said. "I work with a federal veterinary oversight division that monitors retired military working dogs, specifically their post-service medical care. Ruck has been flagged in our system for 6 months due to an unreported shoulder injury that should have triggered a medical evaluation under DoD Directive 2000.36. He paused. "I'm here because someone delayed that evaluation repeatedly, and I want to understand why." The nursing station was not quiet. It was never quiet, but the quality of the noise around them seemed to shift. Sandra said, "I'm not sure what that has to do with..." It probably doesn't have anything to do with your hospital, Wills said pleasantly. But Ms. Voss assessed Ruck's injury yesterday, and I'd like her clinical observations on record. Sandra looked at Nora. The look contained several things: surprise that Nora had apparently done something a federal official was interested in, and irritation at the same, and the particular expression of someone recalculating a situation they thought they had controlled. I can spare 10 minutes, Nora said, without looking at Sandra. They went to the small family consultation room off the main corridor, which had a table and 4 chairs and a box of tissues on the counter that was always there and probably never used. Wills sat across from her. He had a tablet out, the way people carry tablets when they're creating the appearance of bureaucracy, while actually conducting something less structured. Tell me what you observed, he said. Nora told him, concisely in the clinical language she used for documentation. The left shoulder atrophy, the weight compensation, the specific way Ruck planted his feet when he was standing still for extended periods, the scar pattern consistent with shrapnel disbursement, the age-related factors compounding the injury, the behavioral observations, the targeting of Caleb's hand before the PE presented on monitors, the sustained alertness through the code without interference, the immediate response to commands from a stranger. Wills listened without interrupting, taking notes in a way that was sparse and fast. When she finished, he looked at his tablet for a moment. That's a more detailed assessment than the VA specialist provided 4 months ago, he said. I had more time with him. You had 40 minutes. I used them. He looked at her. The same look as last night, measuring, recalibrating. Where did you train? University of Montana, nursing program. Before that, a pause. I did some volunteer work with working animal programs during college. Some technical training. Nothing formal. It was technically true. It was also the least complete true statement she had made in recent memory, and something in Wills's expression said he knew that, and something in hers said she knew he knew, and neither of them pushed the point any further because they were both, in their different ways, people who understood the value of leaving space in a conversation. Ruck needs imaging, she said instead. His shoulder. A proper orthopedic workup. The kind that accounts for how working dogs compensate for pain differently than pet animals. The VA doesn't have a specialist with that background in this region. I know, Wills said. That's part of the problem. He closed the tablet. Thank you for your time, Nora. She stood. What's on the list you're monitoring? He looked up. You said Ruck's injury was on a list. What else is on it? A beat. 14 other dogs, he said. Retired military K9S with documented service injuries that were cleared for retirement without adequate medical evaluation. All from the same 18-month window. All processed through the same contractor. Nora stood with her hand on the door frame. What contractor? That, Wills said, is what I'm here to find out. She went back to her shift. The morning ran hard. 3 traumas before 9. A car accident on the highway outside town that sent 2 patients in simultaneously, and a construction site incident that added a 3rd. Nora moved through all of it with Webb, who was running on his 3rd consecutive day shift and showing it in the slight flatness of his affect, the marginally slower response time. She covered for him where she could, not flagrantly, not in ways that created problems, but in the small ways that an experienced nurse covers for a tired physician, which is to say by making the information he needed available before he had to ask for it, and keeping the floor organized enough that his cognitive load stayed manageable. At 10:40, she checked on Caleb. He was sitting up, more color in his face, the oxygen running at 2 liters via nasal cannula rather than the mask from yesterday. Ruck was beside the bed in his down position. The room smelled like hospital and coffee from a cup on Caleb's tray table that was mostly untouched. Wills talked to you, Caleb said. It wasn't a question. This morning. He has that effect. Shows up, talks to you, and you spend the next several hours feeling like you missed something. He looked at his coffee. He's good at what he does. He just doesn't always tell you what that is. He told me about the list. Caleb was quiet for a moment. He told you more than he usually tells people. Maybe I asked the right question. Caleb looked at her then, and in his expression was something she'd seen before. Not in this hospital, not in Denton Falls, but in other places, in other circumstances she didn't think about in detail anymore. The look of someone who has encountered a person who is operating at a level they didn't expect and is deciding what to do about it. Ruck worked 3 tours, Caleb said. I worked 2 with him. The third was with a different handler after I rotated out. He came back from that tour with the shoulder injury and the scar, and something else that I don't know how to describe except that he got quieter. Dogs like him, they have a baseline noise level. Not literal sound, but a frequency they operate at. His dropped. He put his hand on Ruck's head, automatic, the gesture of years. I got him back when he retired. The VA cleared him for retirement without a full orthopedic evaluation. I knew the shoulder was wrong. I've been fighting to get it properly assessed for 8 months. Wills said 4 months. Wills knows about the last 4 months. The first 4 I was trying to handle through normal channels. The word normal carried considerable weight in how he said it. The contractor who managed the retirement processing, Viridian Animal Services, they hold the DoD contract for K9 retirement medical evaluations. They signed off on Ruck as fit for a standard retirement protocol. I have the paperwork. It doesn't match what I was watching with my own eyes. Nora filed the name. Viridian Animal Services. What did you do with the paperwork? Filed a complaint through the VA. Filed one through the Army Veterinary Corps. Filed one through my senator's constituent services office. He looked at his coffee again. You know what happened? Tell me. Nothing, he said. For 8 months, nothing. And then last week, out of nowhere, Garrett Wills is calling me to ask about Ruck's medical history. What changed? Nora asked. Caleb shook his head slowly. He won't say yet, but something opened. Some door that was closed is open now. He looked at Ruck. I just need Ruck's shoulder properly documented, properly treated. Whatever else is going on, the contractor, the list, whatever Garrett is actually working on, I just need my dog to stop hurting. Nora looked at Ruck. He was looking back at her. I'll make some calls, she said. She meant it as a practical statement. She didn't elaborate. Caleb didn't ask her to. She was back at the nursing station at 11:20 when the overhead went on. Not the full trauma alert, but the department-wide page that meant something was coming that would require all hands. Heads up, all ER staff, the voice from the PA said. It was the charge nurse from intake, whose voice got very flat and controlled when things were serious. We have a multi-casualty incident incoming, industrial accident at the Halverson processing plant on Route 9. Preliminary count is 14 injured, 4 critical. Arrival in waves starting approximately 8 minutes. All available staff report to stations. The ER shifted when a real mass casualty event arrived. Not dramatically, not with the chaos of a TV show, but with the specific quiet intensity of people who have trained for this and are now running the program. Webb appeared from wherever he'd been, and his tired effect was gone, replaced by the version of him that functioned best under pressure. Sandra was directing staff to positions with the efficiency of someone who, whatever else she was, knew her department. Nora went to the bay that had been designated for intake triage. The first wave arrived at 11:29. 7 patients. Chemical exposure, burn injuries, 2 crush injuries from a structural collapse at the plant. The second wave was 7 minutes behind, 5 more, including 2 who arrived unresponsive. What happened over the next 90 minutes was not clean. It was the farthest thing from clean. An IV line blew on a burn patient and had to be restarted under conditions where the patient was in agony and the access sites were compromised. One of the unresponsive patients coded in the bay, and the resuscitation was loud and physical and ultimately unsuccessful, which was the kind of outcome that sat in the room afterward, even after the patient had been moved. A family member got through the intake doors somehow and was standing in the trauma corridor shouting a name until 2 orderlies reached her. Nora moved through it like water finding the path of least resistance. Not graceful, not perfect, but continuous. She went where the need was highest. She called the interventions that needed to be called. When Webb was occupied with the code and the next critical patient was still waiting in the corridor, she made the triage decision that directed resources correctly. A decision that was technically outside her nursing scope and that she made anyway because waiting for the right person to make it would have cost time they didn't have. Dr. Atchison came down from the 5th floor again, along with 2 other attendings and a surgical resident, because Hargrove's mass casualty protocol pulled additional resources, and it was working the way it was supposed to work, mostly. Not perfectly. One of the critical patients had to wait longer than was ideal because the trauma bay was occupied. The burn patients needed more specialized care than the ER was fully equipped to provide and had to be stabilized for transfer. But 14 patients came in and 14 patients survived the first hour, which was not guaranteed when the call came in. In the middle of it, somewhere around the 40-minute mark, while Nora was managing a second IV start on a patient with burns to his forearms and trying to keep him calm enough to hold still, she became aware of someone watching her. Not Wills, not Sandra. Two men standing at the edge of the trauma corridor with the specific stillness of people who are observing rather than participating and have the authority to do so. Both in civilian clothes, but with the same read as Wills. People for whom civilian clothes were a choice, not a default. One of them had a lanyard with a badge Nora couldn't read from across the bay. The other had nothing visible, which in her experience meant something specific. She finished the IV start. She checked her patient's pressure and her patient's airway and moved to the next thing that needed doing, because that was the job, and the two observers were not part of the job right now. The wave subsided at 1:15. Not over. The department was full and would stay full for hours. But the acute intake phase was done, and the stabilized patients were being distributed to the floors, and the trauma bays were beginning to turn over. Nora was at the supply station restocking when Sandra appeared. "My office," Sandra said. Not in the ER director's office, which would have indicated a meeting above Sandra's level. Sandra's own office, which was small and organized with the precision of someone who controlled environments because she couldn't always control situations. She sat behind her desk and Nora stood because the only other chair had a stack of binders on it that Sandra didn't move. "You made triage decisions today that are outside your scope of practice," Sandra said. "I made decisions that the situation required," Nora said. "The attending was occupied with an active resuscitation, which is exactly when the protocol says you wait for the next available physician. The next available physician was 4 minutes out. The patient I triaged had a tension pneumothorax developing. 4 minutes would have been—" "I know what it would have been," Sandra said. "That's not the point." She opened a folder on her desk. "The point is that you have a consistent pattern of acting unilaterally, of deciding that your judgment supersedes the established process. And today, in a mass casualty situation with observers from outside this hospital present—" "What observers?" Sandra stopped. "Who were the two men in the trauma corridor?" Nora asked. "That's not your concern. They were observing a mass casualty response in a hospital ER. That's either a regulatory inspection or a federal oversight visit, and in either case it would be useful for me to understand—" "Nora," Sandra's voice went flat. "I'm telling you, as your direct supervisor, that the formal performance review I initiated yesterday is being escalated. Given today's events, I'm recommending your immediate reassignment out of the emergency department pending review." She paused. "Effective next Monday." Nora looked at her. The folder on the desk had her name on the tab. It was thicker than it should have been for 2 years and 3 months of employment. "You're removing me from the ER," she said. "I'm recommending reassignment while the review completes. Because I correctly triaged a tension pneumothorax. Because you have a pattern." "Sandra." Nora's voice stayed level. Not raised, not sharp, just exact. "In the past 24 hours, I identified a pulmonary embolism before it became fatal, managed a mass casualty intake alongside the attending staff, and correctly prioritized a developing pneumothorax that the next available physician confirmed on arrival. You want to remove me from the ER for that record. I want you to think very carefully about what that looks like when it's written down somewhere that isn't your folder." Sandra held her gaze. "Monday," she said. Nora left. She was in the hallway outside Sandra's office, moving back toward the ER floor, when she turned a corner and nearly walked into the taller of the two observers from the trauma corridor. Up close, the badge on his lanyard read Department of Defense, Inspector General, and had a photograph and a name, Special Agent D. Harlan. "Ms. Voss," Harlan said. Nora stopped, adjusted. "Can I help you?" "We've been observing the department today," he said. He had a different quality than Wills, not warmer, but more direct, the forward energy of someone who operated by moving toward things rather than around them. "Your response to the mass casualty intake was notable." "I was doing my job." "You were doing several jobs," he said, "some of them yours, some of them borrowed." He studied her without apparent discomfort at the directness of it. I'd like to ask you some questions. Not here. He held out a card. This afternoon, if you're available, or tomorrow morning. Nora took the card. DODIG, a phone number, an office address in the Federal Building on Clearwater Street downtown. No email. What's this about? She asked. Viridian Animal Services, he said. The name landed in this conversation with the weight of something that had been sitting on a shelf for months and had just been set down in front of her. I'm available this afternoon, Nora said. Harlan nodded. 3 o'clock. He glanced back toward the trauma corridor. And Ms. Voss, what you did in there today, the triage call. That was right. Whatever your supervisor told you in the last 10 minutes, that was right. He walked away without elaborating on how he knew what Sandra had told her. Nora stood in the corridor with the card in her hand. Down the hall, a bay curtain was pushed aside and Webb came out, chart in hand, moving toward the nursing station. He glanced at her, glanced at the card in her hand, and then did something she didn't expect. He stopped. Voss, he said. He looked like he'd been running on fumes for 3 hours, which he had, and his voice had the particular texture of someone who was about to say something that cost more than it looked like it should. The pneumothorax call. That was good thinking. She looked at him. Thank you, Marcus. She had never used his first name before. He registered it briefly and then kept walking. She went back to the ER. At 2:15, she stopped by Caleb's room to let him know she would be leaving for a few hours. He was asleep, genuinely asleep now rather than the unresponsive stillness of yesterday, which was a relief. Ruck was awake. She paused at the door and he looked at her with the amber steadiness she had stopped finding unsettling sometime around hour 4 of the previous shift. His left shoulder, when he shifted position to watch her, showed the familiar compensation. The slight list. The weight adjustment. She would make the calls tonight. She knew who to call. She hadn't called them in 3 years, and picking up that phone would mean picking up more than just the phone, but Ruck's shoulder was wrong and had been wrong for longer than 8 months, and she was done pretending she didn't know exactly what needed to be done about it. She left the hospital at 2:40 and walked to the Federal Building on Clearwater Street. Harlan was waiting in a third-floor conference room with his colleague, a woman named Special Agent Price, compact and quiet, with a legal pad in the manner of someone who had absorbed a great deal of information about this situation before walking into the room. There was a folder on the table that was considerably thicker than the one on Sandra's desk, and Nora's name was not on the tab. The name on the tab was Viridian Animal Services. Thank you for coming, Harlan said. You said Viridian, Nora said, sitting down. Caleb Merritt filed complaints about them for 8 months and nothing happened. What changed? Harlan and Price exchanged the look of two people deciding how much to share. 3 weeks ago, Price said, a retired K-9 from a different case died during what should have been routine surgery. The operative complications were inconsistent with a properly pre-screened patient. When we pulled the pre-surgical clearance, it had been issued by Viridian. When we pulled Viridian's clearance records for that dog, she paused. They didn't match the physical evidence. Falsified evaluations, Nora said. We believe so, Price said. Multiple dogs, multiple cases. A consistent pattern of clearing animals with significant untreated injuries in order to pass them through the retirement process without the full medical workup the contract requires. She opened the folder to a specific page. Ruck is case number 7 in our current documentation. His scan records from the original evaluation show a shoulder classified as normal. She turned the page toward Nora. Based on your assessment of his presentation yesterday, that classification is incorrect. Nora looked at the scan records. She had not done imaging on Ruck. She wasn't a veterinarian, and a hospital ER was not the place. But the scans in the file were labeled with Ruck's identification number, and she could see, even in the compressed image on the printed page, what wasn't there that should have been. If these scans are genuine, she said slowly, then someone at Viridian didn't just miss the injury. They scanned a different animal. Silence. That's our current hypothesis, Harlan said. Nora sat back. The room was standard federal conference room. Beige walls, fluorescent light, A window looking out at the street below, where an ordinary afternoon in Denton Falls was proceeding without any indication that anything in a third-floor conference room was about to pull a thread that had 17 other threads attached to it. "What do you need from me?" she asked. "A formal clinical statement about Ruck's presentation," Price said. "And, She paused again. "We'd like you to facilitate access to Ruck for a proper veterinary assessment. Given that he responds to you, and that Caleb Merritt is currently in your hospital, you're in a position we don't have anywhere else in this case." "That's straightforward," Nora said. "I can arrange that." "There's one more thing," Harlan said. He looked at her directly. "Viridian has a contact inside Hargrove. We don't know who yet, but someone in the hospital has been providing them with information. Specifically, we believe, about any patient contacts that involve retired military K9S. The room was very quiet. "When Caleb Merritt was admitted yesterday," Harlan continued, "someone accessed his intake record outside of the normal clinical access pattern. The access was logged, which is how we know it happened. We don't yet know who." Nora thought about Sandra, about the performance review that had accelerated with a speed that felt reactive rather than bureaucratic, about the two men in the trauma corridor that Sandra had not wanted to name. She thought about the performance review file that was thicker than 2 years of employment should produce. "How long has your investigation been active?" she asked. 11 months, Price said. Nora looked at the file on the table. Then she looked at the window. Somewhere below, on Clearwater Street, an ordinary afternoon continued, and inside Hargrove Medical Center in a bay on the ER floor, Ruck was watching the door with the amber patience of an animal who had been waiting a long time for something to finally move in the right direction. Nora's phone buzzed on the table. She looked at it. The number was Hargrove's main line. The text was from the overnight coordinator, sent at 3:08 p.m., which was 3 minutes ago. "Call immediately. Caleb Merritt's Bay. Someone accessed the room. Dog is gone." Nora was already standing before she finished reading the text. "I have to go," she said. Harlan was on his feet the same moment she was. "What happened?" She showed him the screen. He read it once and looked at Price, and whatever passed between them in that half-second was the compressed communication of two people who had been working the same case long enough to share a shorthand. "We're coming with you," Harlan said. It wasn't a question. They took Harlan's car. 4 minutes from the federal building to Hargrove. Harlan drove with the focused efficiency of someone who had done this before, not recklessly, but without any of the hesitations a civilian driver would make. Nora sat in the back and called the hospital's main line, got the overnight coordinator, a man named Pitts, who was new enough to the department that his voice still carried a layer of panic he hadn't learned to cover yet. "What do you mean gone?" she said. "The dog isn't in the bay," Pitts said. "Mr. Merritt woke up about 20 minutes ago and the dog wasn't there. He's pretty upset. He tried to get out of bed and we had him on anticoagulant drip. So that was, is Caleb in the bed?" "Yes, we got him back in, but who accessed the room?" "That's what I don't know. The bay camera shows someone in scrubs entering at 2:51. We can't make the face. They had a mask on, which isn't unusual, but the body language was..." He paused. Dr. Webb flagged it. He said the person moved wrong for staff. Webb had flagged it. Nora filed that away. "Lock the camera footage," she said. "Don't let anyone review or copy it until I'm there. And tell Caleb I'm coming." She hung up. Harlan pulled into the hospital lot. 2:51, she said. "That's 10 minutes after Caleb's intake record was accessed externally, based on what you told me." "Yes," Price said from the front seat. "Someone inside the hospital saw Caleb's record, identified Ruck as the dog in our case, and moved within 10 minutes. "That's the sequence," Harlan said, and the way he said it told her he was angry, not loudly, not expressively, but in the controlled way of someone who had been building a careful structure for 11 months and had just watched a variable they hadn't accounted for kick the foundation. They went through the main entrance. Nora badged through the ER doors and moved fast through the department without running, because running in a hospital meant emergency and she needed people calm and cooperative, not alarmed and defensive. Harlan and Price were 2 steps behind her. Caleb's bay was at the end of the recovery corridor. She could hear him before she reached it. Not shouting, but the controlled intensity of a man using a very deliberate voice to communicate that he was not going to accept the situation he was in. "I understand the drip," he was saying to a nurse Nora didn't recognize, A float nurse, probably pulled in from another floor during the mass casualty response and still here. I understand why I need to stay in the bed. What I need you to understand is that my dog is somewhere in this building and he's injured and he does not do well in unfamiliar situations without me. Mr. Merritt, Caleb. Nora came through the curtain. He looked at her with the expression of someone who had been waiting for exactly this. I'm here. Tell me exactly what you remember. He took a breath. The self-regulation of a trained man managing adrenaline response. I fell asleep around 1:30. Ruck was in his down position at the foot of the bed. I woke up at, he checked the clock on the wall, roughly 2:45. He was gone. The curtain was partially open. I could smell. It wasn't a hospital smell. It was something chemical, cleaning product maybe, but the wrong kind, too strong. Chemical deterrent, Harlan said from behind Nora. Caleb's eyes went to him, registered the context of him. Some handlers use aerosol-based scent deterrents to disrupt working dogs' tracking. Makes them disoriented, easier to move. Caleb's jaw set. Someone gassed him. Probably enough to make him compliant without full sedation, Harlan said. He'd still be mobile but not reliably responsive to commands. He'd follow whoever was directing him, Caleb said. If they knew the right body language. Does Ruck have an alert marker? Nora asked. A physical signal? Something someone from outside his unit wouldn't know? Caleb looked at her. Yes. Then he's not fully compliant. He's disoriented, but if someone is trying to move him using generic working dog commands, he'll stall. He'll slow down. Which means he's still in the building, Price said. Probably, Nora said. Hargrove has 3 loading docks and 2 service exits. If someone was moving a large dog out of the building in the middle of a shift change, they'd need at least 15 minutes and a clear route. We're at, she checked the wall clock. 22 minutes since the camera footage. If they haven't left yet, they're still here. Harlan was already on his phone, and the quality of his conversation was the abbreviated, clipped exchange of someone activating resources he already had on standby. Nora heard hospital perimeter and service exits, and do not approach, before she stopped listening and turned back to Caleb. His medical records, she said. The ones Viridian issued. Do you have physical copies anywhere? In my truck. I brought them. I was going to show Wills. He paused. My truck is in the hospital parking structure. Where's Wills now? He left around noon, said he had calls to make. Nora looked at the float nurse who was standing at the edge of the bay with the expression of someone who had signed up for a shift in a recovery ward and had received something considerably different. Can you monitor Mr. Merritt's drip for the next hour? He needs to stay in the bed. The anticoagulant protocol is on the chart, page 2. Yes, the nurse said. Thank you. She looked at Caleb. Truck keys? He pointed to the cabinet beside the bed. She opened it and found the keys on the hook inside, a standard key fob, and a secondary key on a worn ring with no decoration. Silver F250, level 2 of the structure, space 14, Caleb said. The records are in a manila envelope in the center console. There's a second envelope under the driver's seat. Bring both. I'll get them, Price said, and took the keys from Nora. Harlan was off his phone. I have 2 agents covering the service exits and 1 at each loading dock. Building security is pulling the camera network now. Building security reports to the hospital administrator, Nora said. If there's an inside contact, I've already told them this is a federal request. They don't get to filter the footage. Harlan's voice was flat. Who is the administrator? Dale Fawson. He's been here 12 years. Is he on your list of potential contacts? Nora thought about it. Not Sandra. Sandra was rigid and institutional, but her motivations ran toward control of her department, not external loyalty. Fawson was different. Fawson had been present at 2 meetings in the past year where the hospital's DoD service contract had been discussed, and he had been the one to push Hargrove into the Viridian referral arrangement for any veteran patients who came through with working animals. She said, I don't know, but I know who referred Hargrove to Viridian services. Harlan looked at her. Fawson, she said, 2 years ago. It's in the hospital's procurement records. I noticed it when I was reviewing the billing structure for veteran patients my first month here, but I didn't have context for it then. The statement landed in the bay with the specific weight of a piece that had been sitting in the wrong place and had just found its position in the larger picture. You've been here 2 years, Harlan said. 2 years and 3 months. He studied her for a moment with an expression she couldn't fully read. We'll talk about that later, he said. Right now I need you to help me find the dog. She didn't need to be told twice. The hospital's service corridor system was something Nora understood better than most of the clinical staff, because she had spent her first 6 months at Hargrove oriented to the building's physical infrastructure the way she oriented to everything, systematically, from first principles, without assuming she wouldn't need to know something just because her job description didn't require it. The service corridors ran behind and beneath the main clinical spaces, a secondary circulatory system of the building used by maintenance, waste disposal, and supply chain. They connected all 5 floors and both wings and terminated at the loading infrastructure on the building's east side. She took Harlan through the staff-only entrance behind the nursing station, badging them through with her credentials and into the service corridor that ran parallel to the recovery wing. The corridor was institutional, painted concrete block, fluorescent fixtures, the ambient noise of the building's mechanical systems. It smelled like cleaning solution and recycled air. It was also, importantly, not monitored by the same camera network as the clinical spaces. Whoever had taken Ruck had known that. If they know the building, she said, moving at a pace that wasn't quite a run, they'd go south from the recovery wing. The north route adds 4 minutes and passes 2 staffed areas. South route is clear to the loading dock in 3 minutes. You've walked this route. I've walked every route in this building. They went south. The corridor bent left after 40 meters, past the utility room for the second floor, bent left again toward the junction that split toward the east loading dock and the waste disposal area. Harlan's hand went to his jacket. Not dramatic, just positioning. He'd been carrying, she'd clocked it the moment he stood up in the conference room, and he was now making a practiced adjustment that meant he thought there was a reasonable chance they were walking toward a problem. Nora did not have a weapon. She had a hospital badge, a phone, and familiarity with the floor plan, which in the current situation was not meaningless. 20 meters from the loading dock junction, she heard something. Not a voice. A sound. Low, rhythmic, the specific sound of a large animal in mild distress. Not pain, not panic. The disoriented sound of something that didn't understand its environment and was trying to process it. She stopped. Harlan stopped beside her. She made a sound. Low, specific, a short pattern of breath sounds that were not a word in any language. It was the recall marker she'd used yesterday, the one she'd produced without thinking when Ruck was moving alongside the gurney. The sound from the loading dock junction paused. Then Ruck came around the corner. He was moving wrong. The disorientation Harlan had described was visible in his gait, a slight sideways drift, his tracking not quite fixed. He was on a slip lead that had been attached to his collar, the other end trailing loose along the floor. He had gotten free somehow, or the lead had been dropped, or whoever had been moving him had already cleared the dock and left him. He stopped when he saw Nora. His ears came forward, uncertain, but forward. "Ruck," she said. Level, calm, the same register she'd used yesterday. "Hi, He came to her. Not with the fluid precision of a fully operational working dog. The chemical disorientation was still present. She could see it. But he came. He stopped at her knee, and she put her hand on his head and felt him lean into it with the weight of an animal that was confused and tired and had just made a decision about where the safe place was. "Good boy," she said quietly. Harlan was already past them, moving to the loading dock junction, his hand no longer making the positioning adjustment because it was now doing something more specific. Nora heard him identify himself. "Federal agent, don't move," in the tone of someone who said it because it was the required protocol, and not because they expected compliance to be enthusiastic. She stayed with Ruck. A minute passed. Harlan came back around the corner with a man in hospital maintenance scrubs. Mid-40s, heavy set, with the expression of someone who had calculated their position and found it worse than anticipated. He had a phone in his hand that Harlan had clearly removed from somewhere on his person and was now holding in an evidence bag he'd produced from his jacket pocket, with the preparedness of someone who carried evidence bags the way other people carried pens. "Maintenance department?" Nora said. The man didn't answer. "He had Ruck's slip lead," Harlan said, "and a radio on a frequency that isn't hospital standard." He looked at the man. "You want to tell me whose frequency that is?" Still nothing. "Okay," Harlan said. He had the contained manner of someone who was not bothered by silence because silence was just a negotiating position and he had more time than the person offering it. He produced a set of restraints and dealt with the logistics of the arrest with the practiced speed of someone who had done it enough times for the mechanics to be automatic. Two of Harlan's agents appeared from the direction of the loading dock, which meant the perimeter had been active and this had been a coordinated close. The man in scrubs was walked toward the east exit. Ruck watched him go with amber eyes that had cleared slightly, the disorientation lifting at the edges. "That's not your inside contact," Nora said. Harlan looked at her. "He's too operational. He's a hand. Someone who was told to move the dog and given enough information to do it. The actual contact is someone with access to Caleb's intake records. That's clinical staff or administration." She paused. "Or both." Harlan said nothing, which was its own form of confirmation. They took Ruck back to Caleb's bay through the service corridor, which was faster and avoided the main ER floor, where Nora was not prepared to manage the spectacle of returning a Belgian Malinois through the patient area. Ruck moved beside her without the slip lead. She didn't need it, and he didn't need it, and the absence of it mattered. Caleb's face when they came through the curtain was the face of a man who had been doing the thing trained men do when they're scared for something they're responsible for. Containing it, not showing it, holding it in a form that could be converted to action. When Ruck crossed the bay floor and put his head on the bed beside Caleb's hand, the containment dissolved into something more honest and considerably quieter. Caleb put his hand on the dog's head and didn't say anything for a moment. "Thank you," he said finally, and the two words carried more weight than most paragraphs. "He got free from whoever had him," Nora said. She didn't say how. She wanted Caleb calm and in the bed, not cycling back into the adrenaline state. "We found him in the service corridor. He's disoriented but not injured." She examined Ruck herself, as thoroughly as she could without imaging. His eyes, his gait, his shoulder response, his mucous membranes. The chemical exposure was lifting. His pupils were reactive. His shoulder compensation was unchanged, which at least meant nothing new had happened. "He needs a proper veterinary assessment," she said. "I'm going to make the call tonight." Caleb looked at her over Ruck's head. "You keep saying that. Who are you calling?" "Someone who knows working dog orthopedics." "That's not an answer." "It's the answer I have right now," she said. "Tomorrow morning, you'll have a better one." Price appeared at the curtain with the manila envelopes from Caleb's truck. She handed them to Harlan, and Harlan set them on the small table in the corner of the bay without opening them immediately, which told Nora they were evidence and would be handled through a specific process. "We need to talk about access to Caleb's records," Nora said to Harlan. "The external access you identified, I want to know exactly which staff credentials were used." "We're working on it," Harlan said. "Work faster, because whoever accessed those records is still in this building, and Caleb is still in this building, and Ruck is—" She stopped. Recalibrated. "The dog is the evidence. The scans in your file that don't match his actual presentation. That's the proof of falsification. If someone moves against the dog again, the dog will have a federal agent outside his door tonight," Harlan said, "and I'm putting a second one at the entry to this wing. Sandra will have a problem with that. Sandra Pruitt will have to take it up with the Department of Justice," Harlan said, in a tone that communicated he was not concerned about that conversation. Nora looked at him. "You knew about Sandra before today." He didn't answer, which was an answer. She went back to the nursing station. The ER had settled from the mass casualty response into the busier-than-normal evening of a department that had processed 14 additional patients and was still managing the overflow. Webb was at the nursing station, writing notes with the deliberate pace of someone running on empty. He looked up when she approached. "Heard the dog was found." He was. "In the service corridor." "Yes." Webb looked at her for a moment. "Maintenance staff? I don't know what you know," she said carefully. "I flagged the footage because whoever went into the bay moved wrong," he said. "I've done enough shift work to know how people move in hospitals. That person wasn't hospital staff, not regular staff." He paused. "I also looked up the procurement record for Viridian Animal Services this afternoon, after I heard their name come up in the corridor." Nora went still. "It's a straightforward document search," he said, a little defensively. "It's in the hospital's contract management system. Any credentialed staff can access it." He set down his pen. "Fossen brought them in, specifically 2 years ago, and their contract covers any veterinary referrals for patients presenting with former military working animals. He looked at her directly, which means every time a veteran came in here with a retired K9, Fosun's contract directed their dog's care to Viridian. How many cases? Nora asked. I counted 9 in the 2 years I've been reviewing. He paused. I went back 6 years and found 23. 23 cases. 23 dogs routed through Viridian's evaluation process, and on the list Harlan was building there were 15, which meant either Harlan's list was incomplete or not every Viridian evaluation had produced a falsified record, which was in some ways more frightening than a simple scheme. It meant the falsifications were selective, targeted. Specific dogs, specific cases, specific reasons. Marcus, she said, using his first name again because this was not a hierarchy conversation. You need to take what you found to Harlan, the federal agent. Yes. I know who he is, Webb said. I looked him up too. He picked up his pen again, set it down, picked it up. I should have listened to you more. In general, the way you practice, I should have listened more. It was the second time in one day that he had said something that cost him something to say, and the second time she let it sit without performing a response to it, because it wasn't about her and it wasn't about him, and there were more important things happening than the emotional accounting of their professional relationship. Talk to Harlan, she said. Tonight. She clocked out at 8 and went home and made the call she had been putting off for 3 years. The phone rang 4 times. She stood in her kitchen with the lights off, the city outside her window doing its ordinary evening business, and counted the rings. On the 4th, a woman answered. Voss, the woman said. Not a greeting, a recognition. Dr. Tamblin, Nora said. A short silence on the other end. Not surprise. Dr. Eleanor Tamblin did not do surprise in Nora's experience. She did assessment, rapid and comprehensive, and the silence was the sound of it running. I heard you were in Montana, Tamblin said. Denton Falls. I have a patient, a retired K9, 9 years old, Belgian Malinois. Kandahar veteran, shrapnel injury to the left shoulder that was incorrectly cleared during retirement processing. I need a proper orthopedic workup. Cleared by whom? Viridian Animal Services. Another silence, longer this time. Eleanor, Nora said. Do you know that name? I know it, Tamblin said. I've known it for about 7 months. I filed a complaint with the DoD Veterinary Oversight Board 6 months ago that went nowhere. Her voice was controlled, but the control was covering something. I lost a patient, a dog, a retired Navy working dog, 8 years old, died during what should have been a routine joint procedure. The pre-surgical clearance was issued by Viridian. The clearance didn't match the dog. The same dog Harlan had mentioned. Different details, same incident. Nora's mind mapped the connections quickly. There's a federal investigation, she said. Active. DODIG. The agent's name is Harlan. I know Harlan, Tamblin said. He called me 3 weeks ago. Then you know what's at stake. I know what's at stake, Tamblin said. What I don't know is why you're calling me at 8:15 from Montana after 3 years of not calling. Nora looked out her window at the dark. A fair question. The truest answer involved a sequence of events and decisions she had made 3 years ago that had brought her to Denton Falls and to Hargrove Medical Center and to an ER nursing position that was considerably below what she was qualified for. And she had made those decisions for reasons that had seemed necessary at the time. Because I have a dog that needs help, she said. And because I think whatever Viridian did to your patient and to Ruck and to 14 other dogs on Harlan's list isn't the whole story. It isn't, Tamblin said. Not even close. Tell me. Not on the phone. A pause. I can be in Denton Falls by tomorrow afternoon. I'll bring the case files. Another pause, shorter. Nora, are you all right? I'm fine. You left without... I'll explain when you get here, Nora said. Come to Hargrove. Ask for me at the ER desk. She hung up and stood in the dark kitchen for another minute. Then she turned on the light and made tea she didn't drink, and sat at the kitchen table with the version of her history she didn't think about in detail anymore, sitting in the room with her, patient and persistent, the way things you've set aside always are. She had served in a specialized unit, a classified program attached to the Army's Veterinary Corps, focusing on combat animal medicine and field trauma response. 4 years, 2 deployments. The work was specific and demanding, and she had been good at it in the particular way she was good at things, which was completely and without the performance of it. The program had also been where she had first encountered Viridian Animal Services, 3 years before she'd ever heard the company name in a hospital context. She had been 29 years old and a specialist in combat animal medicine, and she had found a discrepancy in the retirement processing records for a dog named Castor, a Belgian Malinois, 6 years old, cleared for retirement with a shoulder injury that didn't appear on his official evaluation. She had filed a report, then another, then a formal complaint through the Army Veterinary Corps. 6 weeks later, her contract with the program had been terminated. The records of her complaint had been reclassified. She had been given a separation package and a very clear understanding, communicated through channels that maintained full deniability, that pursuing the matter further would not be in her interest. She had gone to Montana. She had gotten a nursing degree. She'd had enough clinical training that the program accepted her with advanced standing. And she had found a job at a hospital, and she had kept her head down for 2 years and 3 months. And then a Belgian Malinois with a scar and a familiar shoulder injury had walked into her ER and put his head on her knee. She finished the tea she hadn't drunk and went to bed. The next morning, she arrived at Hargrove at 5:47. The federal agent outside Caleb's wing, a woman, compact, professional, with the seated stillness of someone on a long watch, looked at Nora's badge and nodded her through. Ruck was in the bay when she pushed the curtain aside. Caleb was asleep. Ruck raised his head, saw her, and put it back down. She did her checks on both of them and went to the nursing station. Sandra was not in yet. The overnight staff was finishing their notes. Harlan was in the family consultation room with Webb, which told her the conversation she'd recommended had happened. She started her shift. At 9:14, Sandra Pruitt arrived and went directly to the ER director's office rather than the nursing station, which broke her usual pattern. The ER director was Dr. Colum Beaumont, whom Nora had spoken to exactly twice in 2 years, both times briefly. He was a bureaucratic physician, more administrator than clinician, and his door was almost always shut and almost always indicated a political rather than a medical conversation. Whatever Sandra was saying to Beaumont, it was taking a while. At 10:40, Nora was managing a patient in Bay 5 when Webb appeared at the curtain. His face had the careful blankness of someone delivering difficult information in a clinical setting. "Administration wants you," he said quietly. "Beaumont's office. Sandra's there too. I have a patient. I'll cover," he said. "Go." She finished what she was doing. She did not leave an IV insertion half completed because an administrator wanted her. And then she pulled off her gloves and went down the corridor to the director's office. The room had 3 people in it, Beaumont behind his desk, Sandra in one of the 2 chairs across from it, and a man Nora had never seen before in the second chair. He was in his 60s, silver-haired, in a suit that was expensive in a specific way that communicated not fashion, but seniority. He had a lawyer's face, attentive and giving nothing. "Ms. Voss," Beaumont said. He was a man who defaulted to formality when he was nervous, and he was using the formal register now. "Please sit down." There was no chair left, so she stood. "This is Mr. Gerald Payne," Beaumont said, indicating the man in the suit. "He represents Viridian Animal Services. He's here in a professional capacity to discuss the situation involving the animal currently in your recovery ward," Payne said. His voice was the polished, frictionless voice of someone who had negotiated things for a very long time and knew that most people found that voice reassuring, which was the point. Specifically, there appear to be some questions about Ruck's veterinary records that we'd like to address proactively. Nora looked at him. "Viridian takes the quality of its evaluations extremely seriously," Payne continued. "If there has been any concern raised about the processing of this particular case, our position is that we welcome the opportunity to review the records and—" "Mr. Payne," Nora said, "why are you here and not at the federal building on Clearwater Street?" A pause. Payne's frictionless manner didn't break, but something behind it recalibrated. "I'm not sure I follow. The investigation into Viridian's evaluation practices is being run by the DOD Inspector General's office. Any proactive engagement with the evidence in this case should be happening with the federal agents managing it, not with the nurse who treated the handler." She looked at Beaumont. "Did you call him, or did he call you?" Beaumont's jaw worked. Mr. Payne reached out to the hospital, Nora said, because the hospital has a contract with Viridian, and because someone in this hospital gave him enough information about yesterday's events to motivate a same-day visit from corporate counsel. She let that sit for a moment. That's the conversation you should be thinking carefully about right now. The room was quiet. Ms. Voss, Sandra said, in the voice she used when she was about to deploy institutional authority as a substitute for a better argument. You are being formally placed on administrative leave, effective immediately, pending the completion of your performance review, and in light of what? Nora asked. In light of your conduct during the mass casualty response yesterday, your unauthorized involvement with federal personnel, and your failure to follow established... Sandra. Nora turned to look at her directly. There is a federal agent outside Caleb Merritt's bay. There are 2 more at the service exits. There is a man in federal custody who was arrested inside this building yesterday afternoon attempting to remove the primary evidence in a DODIG investigation. She paused. And the CEO of the company being investigated just walked into the hospital he has a contract with and is sitting in the director's office asking to talk to me. She looked at Payne. You came here thinking I was just a nurse, she said. You came here thinking whoever I was, you could have this conversation and I would be manageable. She picked up her badge from where she'd set it on the corner of Beaumont's desk. I'm not manageable, Mr. Payne, and I'm not the problem you think I am. She walked to the door. Behind her, she heard Payne say something to Beaumont in a low voice, and she heard Beaumont's chair move, and she heard Sandra say, Nora, in a sharp voice, and she kept walking. She was in the corridor 20 feet from the director's office when her phone buzzed. Tamblyn. In the parking lot. Brought the files. Also brought someone you need to meet. Nora stopped walking. She typed back, Who? The reply took 4 seconds. Colonel Dana Rice. Army Veterinary Course. She's been building a case against Viridian for 8 months from the inside. She came out of retirement last week to do it. Nora read the message twice. Then she looked back at the director's office, where Gerald Payne, the man who had, she was now certain, been one of the architects of the scheme that had ended her career 3 years ago, was sitting in a hospital chair believing he had the situation under control. She put her phone in her pocket and walked to the parking lot. But she had taken only 6 steps when the door to the director's office opened behind her and Payne came out, and he was on his phone, and the words she caught, clipped, low, the voice of someone used to being obeyed, were, Destroy the copies, all of them. Do it now. Nora stopped walking. She did not turn around. She stood in the corridor with her back to Payne and her phone in her pocket, and let his words settle into her memory with the precision of someone who had learned a long time ago that the most important information was usually the information people produced when they thought no one useful was listening. Destroy the copies, all of them. Do it now. Do it. She counted to 3. Then she turned, slowly, and walked back toward the director's office as if she had forgotten something. And as she passed Payne in the corridor, she kept her eyes forward, and her pace even, and she did not look at him, which meant he did not look at her, which meant he did not see her thumb moving on her phone screen as she passed. She had activated the voice memo function before she turned around. It had been running for 11 seconds when she caught the tail end of his call. 11 seconds was not a recording, it was a fragment, but a fragment of a corporate attorney telling someone to destroy evidence while standing in a hospital corridor was not nothing, and Harlan would know what to do with not nothing. She pushed through the door to the family consultation room without knocking. Harlan was still there, alone now, Webb having apparently left. He looked up with the particular alertness of someone who had been waiting for something to break and recognized the quality of Nora's movement as indication that it had. She set her phone on the table between them, screen up, the memo still running. Payne just told someone on his phone to destroy copies, she said. I don't know how much I caught. Harlan picked up the phone, listened. His expression didn't change much. It rarely did, but something in his posture shifted. He stopped the memo and played it back from the beginning. The audio was uneven. Corridor noise, her own footsteps, the partial ambient sound of the hospital. But Payne's voice was clear for 7 seconds. Destroy the copies. All of them. Do it now. That's enough, Harlan said. He was already on his own phone. The conversation he had was short and used language that sounded bureaucratic on the surface and was not. When he hung up, he stood. He called from this building's network? Nora asked. His phone would have connected to Hargrove's guest Wi-Fi when he came in, which means the carrier record is associated with this location and the timestamp lines up with his presence here. Harlan picked up his tablet. That's obstruction, on top of whatever else we have. What do you have? He looked at her steadily. More than we did yesterday. She understood that was as much as she was getting right now, which was fine. She had somewhere else to be. There are 2 people in the parking lot, she said. Dr. Eleanor Tamblyn. She's the veterinarian whose case connected to yours 3 weeks ago. And a Colonel Dana Rice, Army Veterinary Corps, retired. Tamblyn says Rice has been building a parallel case from inside the Army for 8 months. Harlan went very still in the way of someone recalibrating a structure they thought they understood. Rice, he said. I know that name. Then you know she came out of retirement last week. I didn't know that. He said it in a tone that told Nora his information network had a gap where Rice was concerned, which was itself interesting. Bring them in. Side entrance. There's a conference room on the first floor east wing that's not in the standard hospital access pattern. Room 114. I'll meet you there. Nora went to the parking lot. Tamblyn was exactly as Nora remembered her. Mid-50s, lean, with close-cropped silver hair, and the manner of someone who had spent decades in environments where competence was the only currency that mattered. She was standing beside a rental car with a messenger bag over one shoulder and an expression that contained 3 years of questions she was not going to ask in a parking lot. Nora, she said. Eleanor, Nora said. They looked at each other for a moment that had several years compressed into it, and then Tamblyn said, You look tired, and Nora said, I've had a long 2 days, and that was the extent of the reunion. Colonel Dana Rice was in the passenger seat of the rental, and she got out when she saw Nora. She was in her late 60s, compact and straight-backed, with the posture of someone who had never stopped being military, even after the military had stopped being her job. She had a face that had spent time outdoors and in difficult rooms, the particular weathering of someone who had absorbed a great deal of institutional resistance over a long career. She looked at Nora with the direct assessment of someone who had been told something specific about her and was checking it against the reality. Your Voss, Rice said. Yes. Eleanor told me what you found 3 years ago, the Castor records. She paused. I want you to know I found the same discrepancy 6 months after you filed your complaint. I also found your complaint, buried in a classified file, reclassified as administrative non-substantive. She said it without softening. Someone made sure nobody would look at it. I know, Nora said. I spent 8 months building a case from inside the Veterinary Corps before I decided the inside wasn't going to work and came out. Rice looked at the hospital entrance. Is there somewhere we can do this properly? Room 114, Nora said. Side entrance. Federal agent named Harlan. Rice nodded once. I know Harlan. I called him last week. A short pause. He didn't know I was coming here today. I wanted to see the situation before I announced myself. Why? Rice looked at her. Because the inside contact at this hospital has been filtering information to Viridian's legal team. If Payne knew I was coming before I walked in that door, I'd know how far the filter goes. Nora thought about Payne's phone call in the corridor. He didn't know, she said. He came here thinking this was a containment visit, a standard problem management operation. How do you know? Because he thought he was talking to a nurse, Nora said, and started walking toward the side entrance. Room 114 was a standard hospital conference room that happened to be in the least trafficked section of the East Wing, used primarily for family meetings during the overnight shift and mostly empty during the day. Harlan was there when they arrived. When he saw Rice, something moved across his expression. Not surprise exactly, but the kind of recognition that came with recalculation. Colonel, he said. Harlan, Rice said, and sat down. She put a case file on the table that was substantial, not the organized bureaucratic thickness of an official investigation file, but the denser, more irregular thickness of something assembled outside normal channels, with notes in the margins and physical photographs and printed emails with headers that told Nora they had been obtained in ways that required careful handling. Tell me where you are, Rice said to Harlan. He told her. 15 dogs on the investigation's documented list. Falsified evaluations across an 18-month window. The pattern of substituted scan records. Imaging from healthy animals used to clear dogs with significant untreated injuries. 1 death, Tamblin's patient. Ongoing VA complaints from multiple handlers that had been systematically unaddressed. The arrest yesterday of the maintenance worker in Hargrove's service corridor. Payne's arrival this morning and the recorded phone fragment. Rice listened without interrupting. When he finished, she opened her file. 27 dogs, she said. Not 15. My documentation goes back further than yours. Harlan looked at the file. The 18-month window you identified is when the falsification became systematic, Rice said. But the pattern starts earlier, smaller scale, less organized, more deniable. Viridian has held the DOD-K9 retirement evaluation contract for 6 years. In the first 3 years, the problems were individual evaluators cutting corners. In the last 3, it became policy. She turned to a specific page. I have internal Viridian communications, obtained through a source I'm not going to name in this room, that show the directive coming from the top, from Payne's client. Who is the client? Harlan asked. Payne isn't just the attorney, Rice said. He's the co-founder. He and a man named Stuart Breck built Viridian 12 years ago. Breck is the operations side. Payne is the legal and contract side. She looked at Nora. Breck is the one who had your complaint buried 3 years ago. He has a contact in the Army Veterinary Corps, a colonel named Whitfield, who is now retired but was in the chain of command for classified program administration when you were in the unit. Nora absorbed this. The name Whitfield landed with the particular weight of something she had suspected in an unformed way and was now hearing confirmed in a form she could use. Where's Breck now? Harlan asked. That, Rice said, is the question. She closed her file. He wasn't in the building this morning? Just Payne, Harlan said. Then Payne is managing the Hargrove situation and Breck is managing the evidence situation. Rice looked at the table. The copies Payne told someone to destroy, they're not in this building. They're at Viridian's regional processing office in Billings. That's where the evaluation files are physically maintained. We have a subpoena for those records, Harlan said. Filed when? Yesterday afternoon. Then Viridian's legal team has known about it since yesterday afternoon, Rice said, and her voice was flat in the way of someone who had watched institutional machinery used against itself too many times. They have had 18 hours to move or destroy physical records before your agents can execute the subpoena. The room was very quiet. Nora said, The scans. Everyone looked at her. The scan records Harlan showed me, the ones filed under Ruck's ID that show a healthy shoulder. Those are the falsified records, but there's a corresponding set of real scans somewhere, the actual imaging done on Ruck during his evaluation. She looked at Rice. Viridian couldn't use Ruck's real imaging because it would show the injury, so they substituted imaging from a different dog. That means somewhere in their system, there's a record of a healthy dog whose imaging was used to clear Ruck, and that dog has a discrepancy in their own retirement file. Tamblin, who had been quiet since sitting down, leaned forward. A phantom animal, she said. A dog whose imaging appears in 2 files. Yes, Nora said. If you can find the duplicate imaging, the same scan appearing under 2 different animal IDs, that's the proof that doesn't depend on physical records in Billings. It's in the digital imaging database. Harlan was already typing. The DoD maintains a centralized veterinary imaging archive for all service animals, he said, half to himself, records going back 12 years. The duplicate would be findable with a hash comparison, Tamblin said. Same image file, 2 different metadata tags. I need a forensic tech, Harlan said. You need one in the next... Nora looked at the clock on the wall. What time does the Billings office open? 8, Harlan said. It's 8:40 now. Then you have whatever time it takes Payne's call to reach whoever is at that office and for them to pull the physical files. She paused. How fast can you get someone to the imaging archive? I have a forensic tech in Helena, Harlan said. 2 hours out. That may not be fast enough, Rice said. I know, Harlan said. He stood up and made 2 phone calls in the corridor outside the room, quick and precise. And when he came back, his expression had the particular quality of someone who had made the best available decision and was now dependent on execution he couldn't personally control. Helena Tech is moving. I also have a digital warrant for the imaging archive in process, but it's not executed yet. He looked at Nora. Is there anything else in this hospital that constitutes evidence? Anything physical in Caleb's possession or otherwise? Nora thought. The original discharge paperwork from Ruck's retirement processing. Caleb brought it in the 2 envelopes from his truck. Those are the physical evaluation documents issued by Viridian. Already in evidence, Price said. She had come into the room at some point in the last 10 minutes without Nora having fully registered her arrival. Logged and photographed last night. Then the physical billings records duplicate what we already have, Nora said. They're corroborating, not primary. Harlan looked at her. You're saying destroying them doesn't eliminate the case. I'm saying the case doesn't collapse if they get to those files first. It weakens. It doesn't collapse. She paused. Not if you get the imaging duplicate. Something in Harlan's face settled. Then we work the timeline we have. He looked at Rice. Colonel, I need your source documentation in evidence format. Can you work with Price on that today? That's why I'm here, Rice said. Harlan looked at Tamblyn. And I need your veterinary assessment of Ruck on the record. Full clinical documentation. I need to examine the dog first, Tamblyn said. Nora can take you up, he said. She did. Tamblyn's examination of Ruck was what Nora had known it would be. Thorough, specific, and conducted with the particular combination of clinical precision and genuine care for the animal that had made Tamblyn exceptional in her field. Ruck, to his credit, tolerated it with the patience of a well-trained animal, though he watched Nora throughout and kept his body oriented toward her as an anchor point in the unfamiliar assessment. Caleb was awake, monitoring all of it, asking Tamblyn questions that were specific and informed, and told Nora he had been doing his own research since before he'd ever brought Ruck to a table saw accident. The shoulder needs surgical intervention, Tamblyn said when she'd finished. The shrapnel fragment shifted post-retirement, probably happened during his 3rd deployment, and the Viridian evaluation either missed it or ignored it. The muscle atrophy is compensatory, developed over at least 2 years of unaddressed pain. She looked at Caleb directly. He's been hurting for a long time. Caleb looked at Ruck, a specific kind of look. The look of someone hearing confirmed what they've known, and the knowing hasn't gotten easier. I know, he said quietly. The surgery has a good outcome probability, Tamblyn said. He's healthy otherwise. I can perform it here if the hospital has appropriate facilities, or we can arrange transport to a specialized center. Here, Caleb said. I don't want him moved. I'll talk to Hargrove's veterinary liaison, Tamblyn said, which told Nora she had already identified that such a liaison existed and that the conversation would be straightforward. Nora left them and went back to the ER floor because she still had a job and patients, and because Sandra had said administrative leave effective immediately, but there was no formal paperwork in her hand yet, and until there was, she was going to keep working. Webb was at the nursing station, and he looked at her when she came in with the expression of someone who had made several decisions in the past 18 hours and was living with them. Administration is looking for you, he said. They'll find me, she said, and picked up the top chart from the rack. Nora? His voice was low. Beaumont is on the phone with the hospital's legal team. Sandra is in his office. And Payne left the building about 20 minutes ago, but not before having a conversation with Fossen that 2 of the admin assistants overheard. He paused. Fossen went to the records room after that conversation. She set the chart down. The records room holds physical copies of all Hargrove contracts, she said, including the Viridian contract. And the referral documentation, Webb said, and any internal correspondence related to the contract management. She pulled out her phone and called Harlan. He answered on the second ring. She said, Fossen just went to the records room. If there's Hargrove side documentation of the Viridian arrangement, it's in there. A short pause. Can you get there? Not without a key card I don't have, she said, but hospital security can open it. Under normal circumstances, I'd need Beaumont's authorization. I'll handle authorization, Harlan said. Meet me outside the records room in 4 minutes. The records room was on the 2nd floor, in the administrative wing that most clinical staff had no reason to visit. Harlan arrived 3 minutes after she did, with the particular pace of someone who had spent the morning moving between locations in a building he'd mapped on arrival. A hospital security officer was with him, holding a key card and looking like someone who had received very clear instructions from a source he wasn't going to question. The records room door opened. Fossen was inside. He was a tall man, Fossen. early 60s, the polished affect of a longtime hospital administrator, someone who had learned to perform institutional authority so well that the performance had become the person. He was standing at a filing cabinet that was open, and he had folders in both hands, and when the door opened, he turned with the controlled expression of someone who had prepared for this possibility. "Mr. Fawson," Harlan said. The folders were in Fawson's hands. Physical folders, labeled with the tab dividers that the hospital's record system used for contract management. "I was reviewing our contract documentation," Fawson said. His voice was practiced and calm. "As the administrator, I have full access to—" "Set the folders on the table," Harlan said. A pause. Fawson's eyes moved to the security officer, then to Nora, then back to Harlan. "I don't think I need to." "Dale," Nora's voice was quiet and exact. "Put the folders down." Something in the way she said it, not loud, not aggressive, the specific register of someone who had run out of time for pretense, reached him in a way that Harlan's federal authority had not quite managed. He set the folders on the table. Harlan bagged them without opening them, each folder logged by the security officer on a tablet Price had apparently provided at some point in the last 12 hours. Fawson stood beside the open cabinet and didn't speak again, and his expression had shifted from practiced calm to the expression of someone standing on a surface that has just revealed itself to be considerably less solid than it looked. "Dale Fawson," Harlan said, with the particular precision of someone completing a required protocol. "You are being detained for questioning in connection with a federal obstruction investigation and potential destruction of evidence. You have the right to—" Fawson said, "I want my attorney." "You're welcome to call them," Harlan said. "You'll have the opportunity shortly." No. He was walked out of the records room by the security officer and one of Harlan's agents who had materialized in the corridor, and the door to the records room closed, and Nora stood in the quiet of a room full of filing cabinets and thought about the shape of the past 2 years with Fawson as a fixed point in it, and how many small things reoriented around that fixed point now that she knew what it was. She went back to the ER. At 1:15, Harlan's forensic tech reached Helena and began the imaging archive comparison remotely, which Harlan told her in a brief message that also said the Billings office had been secured by federal agents who had arrived 43 minutes after the subpoena was executed, which meant there had been activity in the physical records, files moved, a shredder used, but not enough time to complete a systematic destruction. Not clean, not perfect, but enough. At 2:40, Price came to the nursing station and spoke quietly to Nora. "The imaging comparison found it," she said. "One scan file appearing under 2 different animal IDs, Ruck's ID and a dog named Ajax, retired 4 years ago, currently living in Colorado." She paused. "Ajax's handler has been trying to get his dog's shoulder injury addressed through the VA for 3 years. Nora looked at her. "That's the proof." "It's one proof," Price said. "There are 6 duplicate matches so far. The tech is still running comparisons. 6 animals. 6 dogs whose real imaging had been buried while healthy scans stood in for them in the official record. 6 handlers who had watched their dogs hurt and been told nothing was wrong and filed complaints that went nowhere and kept watching." "What happens now?" Nora asked. "Warrants," Price said. "Arrest warrants for Breck specifically. And we have enough now to move on Whitfield, the retired colonel, in Rice's documentation." "And Payne." She paused. "Payne hasn't left Denton Falls. He went to a hotel off the interstate. We've been watching him." "You've been watching him since he left the hospital." "Since he arrived at the hospital," Price said. Nora went back to her patients. The afternoon continued in the specific way of a day where enormous things were happening at the edges of the frame while the ordinary business of the foreground kept moving. 3 new ER admissions, a pediatric case that required a specialist consult, a medication error by a float nurse that Nora caught and corrected before it reached the patient, which added 20 minutes of documentation to her afternoon, and which she did without drama, because that was the job. Webb worked beside her through all of it, and the quality of their working relationship had shifted in a way that was subtle and did not require discussion. He asked her opinion on a case at 3:30, directly and without the framing that had previously made such requests feel like concessions. She gave it. He used it. They moved on. At 4:47, Nora's phone showed a message from a number she didn't recognize. "Nora Voss. My name is Stuart Breck. I believe we have things to discuss. I'm in the hospital. Ground floor, East Lobby. I came alone. I think you'll want to hear what I have before the federal agents do. She stood at the nursing station and read the message twice. Stuart Breck, Viridian's co-founder and operations director. The man who, according to Rice's documentation, had issued the directive that turned corner cutting into policy. The man who Rice had said, arranged to have Nora's complaint buried 3 years ago. He was in the hospital. She forwarded the message to Harlan with 2 words, East Lobby. Then she put her phone in her pocket and walked toward the East Lobby because Breck had come to the hospital knowing the federal investigation was active and knowing Payne had failed to contain the situation and had come anyway, which meant he wanted to make a deal, or he wanted to show her something, or he had calculated something that she needed to understand before Harlan's agents walked through those doors. The East Lobby was the smaller of Hargrove's 2 public areas, a seating section, a coffee cart, windows looking out at the parking structure. It was not busy at this hour. Stuart Breck was sitting in a chair facing the entrance, which meant he had positioned himself to see everyone who came in. He was younger than she'd expected, mid-50s, unremarkably built, with the kind of face that didn't linger in memory. Not the corporate polished look of Payne. Something more operational. Someone who had built a company from the inside out and knew all of its structures because he had constructed them himself. He looked at her when she walked in, and his expression was the expression of someone who had looked up her record and knew he was not talking to just a nurse. Ms. Voss, he said, or would you prefer the rank? She sat down across from him. Not because she was comfortable, because sitting across from someone in a conversation you're controlling was preferable to standing at the edge of it. What do you want? She said. I want to make a practical offer, he said. The investigation is going to find what it finds. I'm aware of that. I'm also aware that Gerald made things worse this morning. A slight tightening around his mouth. Not guilt, more like the expression of someone who had watched a colleague make a bad move. I didn't authorize his visit here. That doesn't narrow my list of concerns about you, she said. No, he said. I know what you found 3 years ago. I know what was done with your complaint. He said it without apology, which was actually more honest than an apology would have been. I want to offer information about the contract structure, about the officials who protected the arrangement, about the money trail, in exchange for a conversation with the federal investigators before they come through that door with an arrest warrant. You want to cooperate, she said. I want to negotiate the terms of cooperation, he said. There's a difference. Why here? She asked. Why come to this hospital instead of calling Harlan directly? He looked at her steadily. Because the people above me in this arrangement are not Viridian employees, he said. They're military officials and government contractors and one sitting senator, and if I walk into a federal office and start talking, I'm a target before I finish the sentence. Coming here, through you, through a conversation that I initiated on my own terms. He paused. It changes the optics. Or you're here because you think I can be managed, she said. Because Payne came this morning and failed, and you're trying a different approach to the same problem. He looked at her for a long moment. Something in his assessment shifted. You had your complaint buried, he said. You lost your career over it. You've been working a nursing job for 2 years and 3 months, and you still came to work every day, and you still caught everything worth catching, and you... He stopped, recalibrated. I'm not here to manage you. I'm here because you're the one person in this building who will understand what I tell you. Tell me, she said. The senator, he said. The sitting senator in this arrangement. His name is... He stopped. He stopped because his eyes had gone to the East Lobby entrance, and Nora turned to follow his gaze. And coming through the door were Harlan and Price and 2 additional agents, and behind them, moving with the specific unhurried pace of someone who has been waiting to walk through this door for a long time, was Colonel Dana Rice. Breck looked at Nora. His expression was not anger. It was closer to something like recognition, the recognition of someone who has played a move and seen it countered and is now deciding what comes next. You texted him when you sat down, he said. I texted him when I got your message, she said. He looked at Harlan approaching across the lobby. He looked back at Nora. The senator's name, he said, quickly and quietly. It's worth more than anything else I have. I'll give it in exchange for a cooperation agreement, not a plea negotiation. Cooperation, on record, with protections. That's not my decision to make, Nora said. I know, he said, but you can tell them it's worth making. Harlan reached them. He looked at Breck with the contained energy of someone who had been waiting for this specific moment and was managing the satisfaction of it into something professional and usable. Mr. Breck, he said. Breck looked at Nora one last time, and then he said to Harlan, I want a cooperation agreement. I'll give you the senator's name, the money trail, the communications chain, everything, in exchange for terms. He paused. And I want her in the room. Harlan looked at Nora. She looked at Breck. Why? She said. Because 3 years ago you were the only person who tried to stop this, he said. And I think you should be in the room when it comes apart. The lobby was quiet around them. The coffee cart was doing its ordinary business. Someone near the entrance was talking on a phone. Outside the windows, the parking structure sat in the afternoon light, and somewhere in it was Caleb's truck. And inside the building was Caleb in his bay, and Ruck at his side, and Tamblin's assessment on the record, and Rice's file in evidence, and 6 duplicated scan files on a forensic tech screen in Helena. And in the east lobby of Hargrove Medical Center, the man who had built the machine that had ended Nora's career was sitting across from the federal agents who had been chasing him for 11 months, saying he wanted her in the room. Harlan looked at her with the question in his expression. She nodded. All right, Harlan said to Breck. Let's go. They walked toward the conference room, all of them, and Nora was 3 steps from the lobby exit when her phone buzzed again. Unknown number. Different from Breck's. A single line of text, no greeting, no signature. Tell Harlan. Whitfield isn't retired. He's been running the program from a DoD advisory position since last year. He's in the building. Nora read the text twice, and then she stopped walking. The others moved ahead of her, Harlan and Price flanking Breck, the 2 additional agents giving them the geometry of a controlled escort without making it look like one. Rice was 4 steps ahead. None of them had seen her stop. She looked at the text again. Whitfield isn't retired. He's been running the program from a DoD advisory position since last year. He's in the building. The number was unknown, and the message had no signature, which meant it was either someone inside the investigation who couldn't identify themselves openly or someone inside the hospital who had been watching longer than she knew. Either way, the information had been sent to her, not to Harlan, which meant the sender understood something about how this situation was structured and had made a calculation about who would act on it fastest. She forwarded it to Harlan, and then she called him instead of waiting. He picked up before the first ring completed, which told her he'd felt his phone buzz and had been expecting her. I just sent you something, she said. A pause while he read it. The pause was 4 seconds long, and when he spoke again, his voice had the careful flatness of someone managing a significant recalibration. Source? Unknown number. I don't recognize it. When did you receive it? 40 seconds ago, while we were leaving the lobby. Another pause. She could hear him processing, not panicking, not rushing, running the calculation of a federal agent who has just learned that the man at the top of his organizational chart is physically present in the location where the investigation is currently active. Keep moving toward the conference room, he said. Bring Breck in. Don't change your pace or your expression. He paused. Can you locate Whitfield if he's in this building? I don't know what he looks like, she said. I'm sending you a photograph. DoD Advisory Directory. Current position listed as Senior Veterinary Oversight Consultant. She heard the particular sound of someone navigating a phone one-handed. Nora. If Whitfield is here, he came because Breck is here. He's not here for containment. He's here to make sure Breck doesn't talk. She understood what that meant. I'm sending 2 agents to the lobby entrances, Harlan said. Stay with Breck. She hung up and walked faster. The photograph arrived as she pushed through the door to the administrative corridor. A headshot from an official directory, the kind taken in a neutral office with a neutral background. Whitfield was in his early 70s, lean, with the silver-gray presentation of a career military official who had spent decades in rooms where the furniture was expensive and the decisions were consequential. His expression in the photograph was the expression of someone who had learned over a long career that showing nothing was the most powerful thing a face could do. She looked at the photograph and kept walking. Breck was already in the conference room. Harlan was at the head of the table with Price to his left and a recorder on the table between them. Not a phone, a dedicated device, the kind used in formal federal interviews. Rice was in the corner chair, not at the table, positioned as an observer rather than a participant. One of the additional agents was outside the door. Nora came in and closed the door behind her. Breck looked at her when she sat down. Something in his expression asked a question she didn't answer. "Before we begin," Harlan said, in the measured register of someone opening a formal process, "I want to confirm that you understand the nature of this conversation. You've indicated a desire to cooperate with this investigation in exchange for formal cooperation agreement terms. Is that correct?" "That's correct," Breck said. "And you're willing to provide the name you referenced in the lobby, the sitting senator with involvement in this arrangement." "Senator Dale Corrigan," Breck said. "Montana. He sits on the Senate Armed Services Committee. He's been protecting the Viridian contract from DoD review for 4 years in exchange for campaign contributions routed through 3 separate PACs. He said it the way someone says a thing they've been holding for a long time. Not with relief exactly, but with the specific exhale of something being set down. I have the documentation, bank records, email correspondence, 2 recorded calls. Gerald doesn't know I kept them. Gerald thought I was as exposed as he was. Harlan looked at Price. She was writing. "I want to give you something else first," Breck said, "before we go further." He looked at the table, then at Nora. 3 years ago, a specialist named Voss filed a complaint about falsified retirement evaluations for a dog named Castor. That complaint was forwarded to Colonel Robert Whitfield, who was at that time in a supervisory position within the classified program Voss was assigned to. Whitfield had Voss's complaint reclassified as non-substantive and her contract terminated. And he paused. That was the first time the scheme had been directly threatened by someone inside the system. Before Voss, nobody had looked closely enough to see it. The recorder on the table ran in silence. "Whitfield didn't bury it alone," Breck continued. "I asked him to. I provided the justification. I told him Voss's complaint was based on misidentified imaging, which was a lie. And I told him that if it wasn't handled quietly, the entire K-9 retirement program would be suspended pending review, which would have left hundreds of dogs in limbo." He said it without looking away from the recorder. "I used the dogs as the justification for protecting the people who were hurting the dogs. I've been aware of that irony for 3 years. But the room was quiet. Nora kept her face still. What she felt was not what she had expected to feel when someone finally said out loud what had been done to her. It was not satisfaction, and it was not relief. It was something more complicated and less clean, something that required more time than she had right now. "Whitfield," Harlan said. "Where is he now?" "I don't know," Breck said. "Genuinely, when the situation at this hospital started developing, I called him. He didn't answer. I've been trying to reach him since yesterday morning." Harlan's phone was in his hand, and he looked at the screen and then at Price, with the look of someone who had just received a notification that confirmed something he suspected. He stood. "I need 2 minutes," he said, and went into the corridor. Nora looked at the door and then at Breck. "He's in the building," she said quietly. Breck went still. "What?" "Whitfield, I received a message 20 minutes ago. Someone told me he's been here." Breck's face did something she hadn't seen it do yet. The specific expression of fear, not performed, not managed, but the real version that surfaces when a person understands that the situation has variables they didn't account for. "He didn't come for containment," he said, and she heard in his voice that he had arrived at the same conclusion Harlan had. "I know," she said. "If he's here—" Breck stopped. Started again. "Whitfield has spent 30 years learning how to make problems disappear inside institutional structures. He's very good at it. But if the institutional structure is collapsing around him, he becomes a different kind of problem." "Operational," she said. "Yes." The door opened. Harlan came back in with the compressed energy of someone managing urgency into controlled motion. "My agents found him," he said. "He was in the administrative wing. He'd accessed the floor with a DoD advisory credential that still has hospital clearance. Apparently, Fossen issued blanket access to DoD advisory personnel as part of the Viridian contract arrangement." "Where's he now?" Nora asked. "He was heading for the recovery wing," Harlan said. She was out of the chair before he finished the sentence. The recovery wing was 3 corridors and 1 elevator from the administrative conference room, and she moved through all of it at the fast walk that was the fastest speed a hospital corridor allowed before it became dangerous for the people moving through it. Harlan was behind her, one of his agents behind him. The elevator was slow and she took the stairs. The federal agent who had been posted outside Caleb's wing was not at her position. Nora stopped at the wing entrance. The corridor was visible from here. 6 bays, curtains partly drawn, the ambient sounds of medical monitoring equipment. The agent's chair was empty. A coffee cup was on the floor beside it. On its side, the small spill already spreading on the linoleum. She did not run. Running communicated emergency to everyone in the wing, and she needed the next 30 seconds to happen with as little noise as possible. She walked fast. Caleb's bay was the 4th on the left. The curtain was partially closed. When she was 10 feet away, she heard a voice from inside. Not Caleb's, not the float nurse's. Male, measured, the voice of someone accustomed to institutional authority. The dog's medical records, the voice was saying. I need to understand what documentation is currently in the possession of federal investigators. She came through the curtain. Whitfield was standing at the foot of Caleb's bed. He was in the DOD advisory suit, civilian, expensive, authoritative, and he was looking at Caleb with the expression of someone who had framed this as a professional inquiry and expected it to be received that way. The federal agent who had been posted outside was standing against the wall with the controlled stillness of someone who had been managed into a corner by a credential that outranked her position. Ruck was on his feet. He had not moved toward Whitfield, and he had not moved away. He was standing at Caleb's side with every muscle in his body at attention, amber eyes fixed on the man at the foot of the bed, producing the same low sound he had produced the day Caleb's embolism was forming. That specific frequency between warning and distress that was not a bark and not a growl, but something more precise than either. Caleb was in the bed, IV still running, and his face had the expression of a man who had been awake and lucid, and had watched Whitfield come in, and had calculated his options and found them limited by the anticoagulant drip in his arm and the bed he was in. Whitfield looked at Nora when she came in. Recognition moved across his face. Not surprise. He had known she was here, had probably known since yesterday, because Whitfield was the kind of person who knew things before he needed to act on them and held them until the moment was useful. Ms. Voss, he said. Colonel, she said. I'm not a colonel anymore, he said. You were when you buried my complaint, she said. A pause. Something shifted in his expression. Not guilt, more like the recalibration of someone adjusting their approach. That complaint was mishandled, he said. I've been aware of that. I came here because I want to provide context. You came here because Breck is in the conference room downstairs cooperating with federal investigators, Nora said. And you came to this specific bay because Ruck is the primary evidence in the case, and because you thought there was still something you could do about that. The bay was very quiet. The monitoring equipment ran its rhythms. Ruck kept making the sound. I want to speak with the federal agent in charge, Whitfield said. He's coming, Nora said. She looked at the agent against the wall. Are you all right? He has an active DOD advisory clearance, the agent said, and the frustration in her voice was the frustration of someone who had been outmaneuvered by a piece of paper. It cleared the hospital's security system. I know, Nora said. It's not your fault. She looked at Whitfield. He was looking at Ruck. The dog has been in pain for 2 years, Nora said, because you protected a company that substituted a healthy animal's imaging for his, because you looked at his real scans and signed off on a clearance that said he was fine. She paused. He was not fine. He's been not fine for 2 years, and Caleb has been watching that and filing complaints and getting nowhere, and you know exactly why he got nowhere. Whitfield said nothing. Say something, Caleb said from the bed. His voice was quiet and exact and contained the specific quality of a man who has been holding something for a very long time. You signed his clearance. You looked at the records and you signed your name. I want to hear you say something. Whitfield looked at Caleb and then away, which was all the answer that question was going to receive. Harlan came through the curtain 30 seconds later with Price and the second additional agent. He looked at the room, assessed it in the rapid way of someone with extensive experience walking into situations that had developed while he was in transit, and looked at Whitfield. Robert Whitfield, he said. I'm aware of who you are, Whitfield said. Then you're aware that you have a choice about how the next 5 minutes go, Harlan said. You can come with us voluntarily, or I can add obstruction to the warrant that's currently being drafted in a federal building 2 miles from here. But either way, you're coming with us." Whitfield looked at the room, at Harlan, at Price, at Nora, at Caleb in the bed, at Ruck still standing with that low, continuous sound. He looked at all of it with the expression of a man watching the structure he had operated inside for 30 years finally complete its collapse. "I'll come voluntarily," he said. They walked him out. Harlan paused at the curtain and looked back at Nora. "Stay available," he said. "I'm going to need a full statement tonight." "I'll be here," she said. The curtain fell closed behind them, and the bay was quiet. Caleb let out a breath that had been held for a measurable amount of time. Ruck crossed the bay floor and put his head on the bed, and Caleb's hand went to him automatically. The same gesture as always, the one that had been happening for 6 years regardless of what was going on around them. Nora checked his IV, checked his monitor. Did the small clinical checks of someone making sure the adrenaline response of the last 5 minutes hadn't done anything to a man on anticoagulant therapy. "You're okay," she said. "Yeah," he said. His voice was rough. "I know." She sat in the chair beside the bed. Not because protocol required it, because she had been standing for a very long time, and because the chair was there, and because this was one of those moments that required a pause before the next thing. "He really came up here," Caleb said. "He really came up here." "To do what, exactly?" "I don't think he had a fully formed plan," she said. "I think he came because the situation was deteriorating, and he spent 30 years solving deteriorating situations by being physically present and projecting authority. It's the only tool he had left." Caleb looked at the curtain where Whitfield had gone. 30 years, he said, and all it took was a dog's medical records. "And someone who looked at them," she said. He looked at her then. "You looked at them 3 years ago." "Yes, and they buried it." "Yes, and you came here anyway, to this hospital, and you kept looking." She didn't have a clean answer to that. The true answer involved 2 years of working graveyard shifts and getting passed over and signing up for a life that was smaller than what she'd been capable of, because smaller meant less visible, and less visible meant safer. The true answer was not particularly heroic. It was what people do when they've been hit hard enough that retreat feels like the only rational response. And they retreat. And then they keep doing the work anyway, because the work doesn't care about the retreat. "I didn't come here looking for this," she said. "It came looking for me." Caleb nodded slowly. "Ruck came looking for you," he said. "In the ER. He walked right to you." "He knew," she said. She looked at the dog, who was now in his down position at Caleb's side, the alert sound finally quiet, his eyes half closed with the specific release of an animal whose vigilance has been resolved. Animals know things about people that people don't advertise. What did he know about you? She thought about that honestly. "That I wasn't going to walk past him," she said. What followed was not clean, and it was not quick, and it contained none of the cinematic compression that the word resolution implies. It was federal process, interviews and statements and legal documentation, and the specific grinding pace of an institutional reckoning that has to be built from evidence upward rather than revealed in a single moment. Nora gave her statement to Harlan and Price that evening, all of it. The Castor records 3 years ago, the complaint, the termination, the decision to come to Montana and begin again. She said it in the flat clinical register she used for things that were difficult, without performance, without editing it into something more comfortable. Price recorded it. Harlan listened with the quality of attention that told her he was hearing not just the events but the shape of them, the pattern of an institutional structure that had been specifically designed to make what she'd experienced unreportable. "Your complaint was the first," Harlan said when she finished, "the first documented challenge to the Viridian arrangement from inside the system. If it had been acted on—" "I know," she said, 27 dogs. 27 dogs, he said, and however many handlers who watched it happen and couldn't get anyone to listen. She sat with that. It was the accounting she had been avoiding, in the quiet way you avoid things that are too large to hold in normal hours, and now she held it, and it was exactly as heavy as she had known it would be. "What happens to the senator?" she asked. "Senator Corrigan is going to have a very difficult few weeks," Harlan said. "The PAC records Breck provided are specific and documented. The Armed Services Committee connection is the part that's going to be public first. It'll be DOJ making the announcement, not us, but it'll be made." He paused. He won't be on the committee much longer. Payne? Charged. Federal obstruction, conspiracy, wire fraud. He was arrested at his hotel at 6:15 this evening. Harlan looked at his notes. Breck's cooperation agreement is being processed. He'll face charges, conspiracy, and fraud. But the cooperation terms will reflect the information he provided. Whitfield is facing obstruction and abuse of position charges, and based on Rice's documentation, possibly more. He looked up. Fossen is cooperating. He was the inside contact at this hospital. He flagged Caleb's admission to Payne within an hour of intake. He's going to cooperate fully in exchange for reduced charges. Sandra? She asked. Harlan shook his head. Sandra Pruitt doesn't appear to have known anything beyond the standard hospital relationship with Viridian. She's not implicated. A pause. Which doesn't mean her management of your employment situation is something the hospital won't have to address. Nora thought about that. What about my records, the ones from the program? We've already filed to have them reclassified, Price said. Your complaint, your service record, the Castor case documentation. It'll take a few weeks for the formal processing, but the reclassification will stand. Your record will show that you identified the scheme correctly and reported it through proper channels and were wrongfully separated as a result. She looked at the recorder on the table. The weight of 3 years lived under a version of events that wasn't true was not something that lifted immediately when the true version was finally acknowledged. It settled slowly into something you'd carry differently. Not lighter, exactly, but with the knowledge of what it actually was. Thank you, she said. It was the only thing that fit. Mom. Tamblyn performed Ruck's surgery 4 days later, in Hargrove's surgical suite with a veterinary team assembled from the university's veterinary medicine program 30 miles north. Nora was not in the suite. She was not a veterinarian, and the suite was not her space. But she was in the recovery area when Tamblyn came out, still in her surgical cap, with the expression of someone who had done difficult technical work and it had gone the way it was supposed to go. He's out, Tamblyn said. The fragment came out clean. The joint is in better shape than the imaging suggested. Compensatory muscle changes are significant, but recoverable with the right rehab protocol. He'll have full function. She paused. Probably. Bodies don't always follow what the imaging promises. I know, Nora said. But probably, Tamblyn said. He's tough. He is. Caleb was in a wheelchair in the corridor. Discharge had been the day before. The anticoagulant therapy transitioned to oral and manageable, but he had come back this morning for the surgery and nobody had suggested he wait elsewhere. He looked at Tamblyn when she came out and asked the question with his eyes rather than his voice. He's going to be okay, Tamblyn said, simply and directly, the way Nora had learned she delivered all information. Caleb put his face in his hands for a moment. Just a moment. Then he lifted it and looked at the surgical suite door. When can I see him? 2 hours, Tamblyn said. He needs to come out of anesthesia in a calm environment. You can be there when he wakes up. He was. Nora watched it from the doorway of the recovery area. Caleb's hand on Ruck's head when the amber eyes opened, the slow blink of an animal coming back to consciousness and finding the first thing it saw was the person it was built to find. Ruck's tail moved once, then again. Then he tried to lift his head and Caleb said, "Easy," in the quiet voice of someone who had said that exact word to that exact animal in exactly that register for 6 years, and Ruck put his head back down and was still, and the tail kept moving. Nora went back to work. The formal process of her reinstatement, that was the word the hospital's legal team used, reinstatement, which acknowledged implicitly that something requiring reinstatement had occurred, took 11 days. Beaumont called her into his office on the 12th day, and the meeting had a quality she hadn't experienced in this building before. He was uncomfortable. Not hostile, not defensive, genuinely uncomfortable in the way of someone who has understood, finally and fully, what happened in the institution they are responsible for. The performance review initiated by Sandra Pruitt is being withdrawn, he said. All documentation associated with it is being removed from your file. He paused. The 2 prior write-ups are also being reviewed. Based on the outcomes of the cases involved, we're withdrawing those as well. Nora sat across from him and said nothing. I want to discuss your position going forward, Beaumont said. The hospital is creating a clinical oversight role, a patient safety coordinator position with authority to review and escalate clinical concerns across departments. It's a new role. We think you're the right person for it. Why? She asked. He looked at her. Because you've been doing it without the authority for 2 years and 3 months, and the outcomes speak for themselves. A pause. And because the hospital owes you something that money and a title can't cover, but that we should try to address in concrete terms regardless. She looked at the window behind his desk. The same Montana sky she'd been looking at for 2 years, the flat, wide sky that she'd never fully gotten used to. She'd come here running from something, and she'd stayed because leaving felt like running again, and she was tired of running. I'll take the role, she said, on one condition. Name it. Webb keeps his position, she said. He flagged the camera footage. He went to Harlan on his own. He's not a perfect attending, but he's a good one when he's working with people who push back. And the department needs that combination more than it needs a clean hierarchy. Beaumont looked at her for a moment. That was already not in question, he said. But I'll note that you asked. She nodded and stood. At the door she stopped. Sandra, she said. Ms. Pruitt is in a difficult position, Beaumont said carefully. She doesn't know anything about Viridian, and she didn't participate in Fossen's arrangement, Nora said. She managed her department the way she understood it should be managed. She was wrong about a lot of things, but the wrongness was institutional habit, not malice. She paused. I'm not asking you to reward her. I'm asking you to be clear about what she actually did versus what the hospital's atmosphere allowed her to do. Beaumont was quiet. That distinction matters, Nora said. It matters because if you don't make it, the next person in her position does the same thing and calls it institutional culture. She left the office. The DOJ announcement came 17 days after Brecht's cooperation agreement was finalized. It was a federal press conference, not a hospital one, and Nora watched it on her phone during a lunch break in the family consultation room, the same room where she had first sat across from Harlan with a fragment of audio and a case she was only beginning to understand. Senator Corrigan's name was in the third paragraph of the official statement, which meant it was in the second paragraph of every news report that followed. The language was specific and documented: campaign contributions, committee interference, protected contract arrangement. He resigned from the Armed Services Committee by 4 p.m. and announced he would not seek re-election 2 hours after that. The announcement from his office used language about wanting to spend more time with family, which everyone understood to mean what it meant. Gerald Payne was indicted on 7 counts, federal. Stuart Brecht on 4, reduced from 11 by his cooperation. Robert Whitfield on 3, obstruction, abuse of position, conspiracy, with additional counts pending based on the documentation Rice had spent 8 months assembling. Fossen's cooperation produced 2 counts with a sentencing recommendation that reflected the cooperation. The Viridian contract with the Department of Defense was terminated the morning of the announcement. The K-9 Retirement Evaluation Program was placed under direct DOD oversight pending a full review. All 27 dogs on the documented list were ordered to receive independent veterinary assessment at government expense, with treatment authorized and funded based on those assessments. Ajax, the dog in Colorado whose imaging had been used to clear Ruck, had a shoulder injury that had gone unaddressed for 4 years. His handler, a retired Marine named Delgado, had filed 9 complaints. He called Nora 3 weeks later. Harlan had shared her contact information with Delgado's permission, and the call lasted 40 minutes and covered things that were difficult to say and necessary to say, and left them both quiet in the way of people who have found someone else who understands the specific weight of a particular kind of waiting. Rice was formally recognized by the Army for her 8 months of independent case building. The recognition was not public. It was the internal, specific recognition of an institution acknowledging, within its own structure, that someone had done something at considerable personal cost and had been right. She called Nora the day she received it. It's not enough, she said, which was true. It's something, Nora said, which was also true. Are you staying in Denton Falls? Nora looked at the window in her office. The new office, the patient safety coordinator office, with its view of the hospital's east parking structure, and beyond it, the edge of the Montana sky. For now, she said. They offered you your commission back, Rice said. It wasn't a question. The Army had offered her a return to active service, reinstated at the rank she would have held had she not been separated, which Harlan's case had established was wrongful. The offer had been in writing, formal, signed by someone with enough stars on their collar to make it official. "I know," Nora said. "Are you taking it?" She thought about the ER floor, about the pediatric asthma case last week that she'd managed before the attending arrived, and the attending had used her notes without comment, and the outcome had been what it should be. About the patient safety review she was building from the ground up, a system that would make the small catches possible and documented and credited rather than invisible and disputed. About the fact that she had spent 2 years and 3 months doing work that mattered in a place where nobody knew it mattered. And there was something about that she wasn't ready to leave. "Not right now," she said. "Maybe later. Right now I'm needed here." Rice was quiet for a moment. "You were always needed somewhere," she said. "You just weren't always in a place where they knew it." Nora didn't answer that because it was true and complete and didn't require addition. 6 weeks after the DOJ announcement, on a Tuesday morning in late autumn when the Montana sky was the particular clear cold blue of a season turning, Ruck walked back into Hargrove Medical Center. He walked in through the main entrance this time, with Caleb beside him and a leash that was more ceremonial than functional. His gait was different, not perfect, not the gait of a young working dog, but even, steady. Moving without the compensation pattern, the weight shift, the slight favoring that had been there for so long it had become the baseline. He was moving like an animal that had stopped hurting. Caleb stopped at the intake desk to sign the visitor log, the ordinary bureaucratic requirement of a hospital visit, and Ruck waited beside him with the patience of an animal that understood waiting because it had spent years doing it. They came through the ER entrance at 8:14. The department was in its morning rhythm, charts and handoffs, and the first wave of the day's cases. Webb was at the nursing station. The float nurse from 3 weeks ago had become a permanent placement and was at the medication cart. 2 orderlies were moving equipment toward Bay 6. Ruck walked through it. Not urgently, not with the purposeful speed of the first day he'd come in. Slowly, deliberately, in the way of an animal that knows where it's going and has decided the pace it's going there. He came to the nursing station. Nora was there with a chart in her hand and a coffee she hadn't drunk going cold beside her keyboard. She heard the department shift slightly, the small collective awareness of people noticing something, and looked up. Ruck stopped in front of her. He looked at her with the amber eyes that had looked at her across emergency rooms and federal conference rooms and surgical recovery areas and hospital corridors, and then he did what he had done the very first time. He lowered his head and rested it against her hands. The chart was in her left hand. Her right hand went to his head without thought, the automatic response of someone who had spent enough time with this animal that the gesture existed below the level of decision. The ER was quiet for a moment, not completely. The monitors ran, a phone rang at intake, someone down the hall said something about a blood draw, but the specific human quiet of people who understood what they were looking at. Webb was at the nursing station 3 feet away. He looked at Ruck, then at Nora, then back at his chart, and said nothing, which was the most honest response available. Caleb was behind Ruck, watching, and his face had the expression of a man who had come here specifically for this moment because he thought Nora deserved to see it with her own eyes. Nora looked down at Ruck. She thought about the first time, the crash of the ER doors, and the scattered nurses, and the silence that had followed when this animal had walked past every other person in the room and stopped at her knee. She had not known then what she knew now. She had not known that the dog was evidence, that he was the thread that would pull everything else loose, that his shoulder injury was the record that held the proof of something that had been buried for 3 years and needed someone to finally dig it up. She had not known any of that. She had just recognized a working animal in a place he shouldn't have been alone, and she had given him a command, and he had followed it, and everything after that had been what followed. The truth about systems that fail people, about the institutional arrangements that protect themselves at the expense of the things they're supposed to protect, is that they do not collapse all at once. They collapse because someone refuses to walk past the thing that's wrong, because someone orders the right lab test even when the doctor hasn't asked for it, because someone looks at a dog's shoulder and knows what the scan should show and knows it doesn't match, because someone files a complaint that gets buried and then comes back 3 years later and keeps working. It is not heroic. It does not feel like heroism from the inside. It feels like doing the job in a place where the job is harder than it should be, and continuing to do it, and continuing until the thing that was buried surfaces on its own because buried things always do. Noor had spent 2 years and 3 months being told, in ways overt and covert and institutional, that she was difficult, that she didn't understand hierarchy, that her judgment exceeded her authority, that her temperament was the problem. Her temperament had saved the lives of people whose names were in charts she could no longer access. Her temperament had kept a dog's real injury in her memory until she could do something about it. Her temperament had sat across from a corporate attorney and not flinched, had walked into a loading dock corridor without knowing what she'd find, had given a statement on the record about the worst professional experience of her life without editing it into something easier to say. She was not perfect. She had retreated when she should have pushed, some of the time. She had worked jobs smaller than she was capable of because she was tired and because the cost of fighting felt higher than she could pay. She had let 2 years go by in a hospital where she was dismissed and diminished before the thing she'd been looking for found its way back to her. But she had not stopped looking. And the thing about not stopping, about the particular stubbornness of people who keep doing the job, even when the job doesn't recognize them, is that it eventually finds its return. Not always, not neatly, not without cost. But sometimes the dog walks into the room and puts his head on your hands, and the people around you see it, and they know. They already know. Ruck lifted his head from her hands and looked at her with the even amber eyes of an animal that had made its accounting and found it complete. She looked back at him. "Good boy," she said. "Go find your dad." He turned and went to Caleb, and Caleb's hand went to his head, and the ER continued around them. Phones and monitors, and the morning's ordinary disasters beginning their ordinary arrival. And Nora Voss picked up her cold coffee and her chart and went back to work. Because that was what she did. Because that was what she had always done. Because the work was there and she was there, and no one who had ever told her she didn't belong had managed to make that untrue.